just going to say, Tom, we got your fingers.
Yeah, I know.
Tom, we got you.
Yeah, it's just not, for some reason, this is my little quirks showing up. I want to be in the center of the screen and I'm not. I'm on the left side. So I can't quite figure out why. Is that better? Oh, well.
Just looking one more time through the list to see if we have every board member to suggest that we start. I'll text the one board member I don't see just to see if they're having any IT issues.
Just an FYI. Oh, it's okay. It's okay. Sorry. Just an FYI. It took me about 4 minutes to get in and I tried right at 9. So they may be sitting there waiting.
Thank you, Marlene, for sharing that. I think
You're welcome. Yeah.
You look fine off center. It's your
Would
creative.
you like us all to mute that are just here, not board members?
yes, please. That would be helpful, Rosemary. And I think staff, you have that control feature as well.
Okay, mute.
So I suggest we get started.
Okay. All right. Welcome, everybody. I am calling this meeting to order. Today is June 30th, 2022, and this is the PEB board meeting. Due to COVID-19, the board has agreed to meet via Zoom only through the remainder of this board season. What I'd like to do first are board member introductions. I'll do a roll call to identify the board members who are with us today. So board members, if you'll take yourself off of mute as I call your names. Harry Bossy.
Here.
Thank you, Harry. Good morning. Scott Nicholson.
Here.
Hi, Scott. Elliot Weinstein.
Here.
Thank you. Monica McLemore.
I'm present.
Thank you, Monica. Tom McRobert.
Present, sort of.
Great. John Comerford.
Present.
And Leanne Kunze.
I don't see Leanne yet, but I've reached out to her to see if she's having IT issues. I haven't heard from her, but we'll check on her.
And we'll make note when she joins, staff, if you'll flag that for me if I don't catch it. And I'm hoping board members, if you're like Tom, you're getting a little more coffee to be as present as ever. Also, Michael Tunick from the Attorney General's office. I saw that you were on, Michael.
Yes, good morning, Chair Birch, and I do have my coffee. Thank you.
Great. And I'm Sue Birch. I'm the board chair. Now, for a few reminders, with both board members and presenters attending virtually, it'd be helpful for the board to hold their questions until each presentation is done, or when the presenter pauses and asks if there are questions. Board members, we will also watch in case you use your Zoom's raise your hand feature to indicate you have a question. And I know from previous meetings, if you need to use your physical hand and or interrupt if we're moving on, but we seem to be catching everybody. So we've got this down. I anticipate that we will have many members of the public who are joining us for the first time or haven't joined us for a meeting recently. So first, for all of our members of the public, welcome. And we're very, very pleased that you have joined us today. Second, I want to describe a little bit about when the board takes public comment in our meeting. There are usually two different times we take public comment. First, when there is a specific motion being actively considered by the board. And second, when we call for general public comment at the end of the meeting. The general public comment time is quickly identifiable on our agendas shortly before we adjourn. You will not, I will make it very clear, so you will not be passed over or confused. When we get to that part, we will very clearly identify this. The time for public comment about a specific resolution or motion is part of the time indicated on the agenda items listed for action, which is noted in the far right side column in our agenda. We always take public comment on any resolution that is moved for adoption shortly before taking any vote. Today, we are also organizing a segment specific to those who want to speak about the UMP Classic Medicare Plan. In a few minutes, Dave Eisminger, our director of the PEB program, is going to provide more insights on how we will organize public comment today on that topic, knowing we have more members of the public interested in speaking than our usual meetings. On another note, I do want to just call out that Washington recently was ranked the fourth highest healthcare performing system in the nation. This is through the Commonwealth Fund's 2022 scorecard on state health system performance. And I want to thank the PEBB staff, our Employee Retirees Benefits Division, because they are part of how we continue to be transformation leaders and how we continue to offer the greatest value and to be bold about shaping healthcare policy and moving things in the right direction. So any of you board members that are interested, please open up. I'll have staff send you the rankings. It really does a remarkable job calling out our successes around COVID-19, our successes around access and affordability, prevention and treatment, avoidable hospital use and cost, healthy lives, income disparity, racial and ethnic equity. So we really do a phenomenal job. Of the Western states, we're 2 of 6, and in the country, we're 4 of 51. So PEBB team, you are a big part of the HCA ship and really for the past decade have been shaping kind of the transformation journey. Now, I also want to thank members of the public for joining us. First off, we want to thank you for all your feedback. Your letters have flooded in, your calls. It helps us continue to transform and to offer better services for all of our benefits. For all of our beneficiaries. So I want to thank you wholeheartedly. I think you're going to be pleased about our pivot today of how we want to take more time to really fully understand the implications of our offerings. So Dave will get to that in a little bit more here in just a minute, but I want to truly thank you all for expressing yourselves. Civil discourse these days is not so easy, and all the comments were respectful, and they were copious emails and letters that came in, and we appreciate that. We need feedback, so thank you very much. Now I'd like to turn it over to Dave, and he's going to provide us with an overview of today's agenda, and then he'll make some follow-up points from our June 9th board meeting. So Dave, take it away.
All right, good morning, Chair Birch, members of the board. In a few minutes, I will provide some follow-up related to the last board meeting on the 9th, and then we will go into a brief executive session, and the reasons for that executive session, Chair Birch will describe. After the executive session, Christine will bring back to the board 2 actions that were introduced at the last board meeting that are related to the UMP Consumer Directed Health Plan. That's the CDHP plan that's offered to members in the non-Medicare risk pool for action. And then she'll introduce a new resolution for consideration at the next board meeting in July. Then we'll hear from Ellen, a regular presenter for you all board season, as well as Luke from our clinical pharmacy team. They're here to bring you a robust presentation addressing many, but not all, of the questions asked by you and members of the public over the last several weeks about offerings to retirees in the Medicare risk pool. Then we'll move to Sarah from our finance team, and she'll be bringing back for board consideration several resolutions related to setting the explicit subsidy and the Medicare plan premiums for 2023. And this is where I want to pause for a moment and very clearly state for everyone that there is no vote planned today for resolution 2022-12. That's the resolution presented at the last board meeting that included the concept of closing the UMP Classic Medicare plan at the end of 2023. Instead, the resolution that will be scheduled for action is 2022-15, which only addresses settling the UMP Classic Medicare premium for 2023. Now, some members of the public may wonder why resolution 2022-12 is in the materials if it isn't being scheduled for a vote. And that'll be addressed a little further later during Sarah's presentation. But a key reason is so that the board could easily compare the language from that resolution that was introduced to the new resolution 2022-15. But again, I want to repeat that there is no vote that is planned today for resolution 2022-12. After the board acts on the premium resolutions, Chair Birch will then open for public comment the remaining time set aside during Sarah's presentation for public comment about the importance of UMP Classic Medicare and or concerns generated to the original proposal about potentially closing that plan. But again, that's not scheduled for vote. Around 1:30, Chair Birch will call for general public comment about any other topics. And if there are none, then that time can be used for additional public comments about the UMP Classic Medicare plan until the board adjourns at 2. And a quick note, because I always like to highlight where we are in our virtual backgrounds for HCA. This background that I and Sue and the presenters will have as fir trees and Lake Crescent of Clallam County. That's our Zoom background for today's meeting. So that's the overview of today's agenda. And now I'm going to move into some follow-up on the June 9th board meeting and also describe how we hope to organize public comment for today's meeting. Questions asked at the last meeting are either embedded in today's presentations or some are still being worked on for presentation at a future board meeting. We were together just 3 weeks ago, but we do our best to answer as many questions, and sometimes we need a little bit more time and they come up at even further board meeting in the season. But I do want to provide some follow-up comments generally about PEB resolution 2022-12. Board members know that the typical practice of the board is to hear a recommended policy resolution at one meeting, and then they are automatically scheduled for action at the next meeting. Between those meetings, HCA receives feedback, questions, insights, and sometimes that prompts changes in the resolution language, and other times it's prompted a delay in a vote so more information can be gathered and presented to the board. That's a process that is used by both this board and the SEB board, and it's been used for all decisions, large and small. Now, resolution 2022-12 was without a doubt a significant policy proposal. And with such a significant policy proposal, automatically scheduling it for action at the next meeting has unnecessarily caused a lot of anger and fear. And I want the board and public to hear that this was never intended, and for all the feelings invoked, we really are truly sorry. I'm sure board members have been reviewing the letters and emails about the proposal that have been received, as have I. Many have questioned the motivation behind making the closure proposal, and I only want to briefly address that because, again, there's no vote planned on that resolution today. Succinctly put, the proposal focused on the fiduciary responsibilities related to running the PEB program. But as retirees have pointed out in the past several weeks, there are many, many other important considerations beyond simply fiduciary ones. With the feedback we've received, we realize more time and communication is needed, not to push a closure proposal, but instead to discuss and ensure that there are plans that are available that meet all retirees' needs. And also to provide important information about some unique protections and safeguards built into the plans offered to retirees, which make them very different from similarly named plans in the commercial market. HCA wants to take a big step back, engage, listen, and also provide information to ensure a balance between affordability, provider access, and benefit design. And with that said, I also want to be clear that in addition to no vote occurring today, there is no timeline to revisit the closure proposal in the future. Not this board season, which is planned to end in July, not this September or fall, not even during the 2023 board season. HCA will engage and work with retirees and retiree stakeholder groups to both explain some significant challenges that make UMP Classic less competitive and subject to higher premium increases, and listen to approaches that retirees that balance the needs of the diverse retiree population. This will be hard work, and they will not always be easy conversations, but rarely is important work that has such a big impact on our lives or the lives of our friends, colleagues, and families. remembering that we are all public servants here at HCA, and we all personally know and care about the retirees, employees, school employees, and the dependents that we serve. So thank you for listening, board members and the public, to those follow-up comments. I'm now going to turn to how we are trying to organize public comment today. We know that many people attending want to speak about UMP Classic Medicare and concerns or concerns with other Medicare retiree options. We typically wait until we reach a public comment period and ask people to virtually raise their hand. But in this instance, we think that that will unnecessarily delay the start of public comment and could end up being unnecessarily disorganized. So when the board enters executive session in a few minutes, there's going to be a slide that's broadcast and maintained in the virtual public meeting room, asking people to send an email to a specific HCA inbox indicating you want to speak during public comment. HCA staff will create a list of public speakers based on the order emails are received, and then Chair Birch will use that list to call on people when we reach public comment about the UMP Classic Medicare topic later in the board meeting. We will assume that anyone sending an email to the inbox during the meeting wants to speak about UMP Classic Medicare. You don't need to describe your testimony at all. You don't need to have a long email, just an indication that you're testifying. And after you send that email, I strongly encourage you to stay signed in and connected to the meeting because of the intense public interest in this meeting. I want to make sure you don't have troubles re-entering it. Are there any questions I can try to answer for the board? I turn it back to you, Chair Birch.
Thank you, Dave. Really appreciate the clarification. And truly, this is why civil discourse and public input is so welcome and used throughout the history with the PEB board. And I know that we will come to good resolution in the years to come as we keep transforming and creating greater value. So let's get back to our usual business. So we are going to go into executive session, again, for members of the public that haven't experienced this. Pursuant to RCW 42.30.1101L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state-purchased healthcare services as provided in RCW 41.05.026. The executive session will conclude no later than 9:55 a.m. Members of the public, mark your timer and rejoin us when the board comes back into session. So Dave and staff, can you beam us to our appropriate rooms, please?
Do one thing for the record. While I was doing my opening comments, Leanne joined. I just want that for the record.
Oh, and thank you. Good morning, Leanne Kunze, who is one of our board members. Thanks for joining us.
Yes, good morning.
Jessica, please beam us away and then put that slide up for public comment to be organized.
Because we were just coming back in to the full public meeting. And I don't see Dave yet.
I'm here, Sue.
Oh, okay. So Dave, I think we just were asked by, I'm sorry, I didn't capture your name, Larry.
Jessa.
Thank you, Larry. So Larry, we always make available our meeting to the general public. They are recorded. And Dave.
No, they are not. They're not being recorded. If they're recorded on an audio, I know from a fact that they're unavailable on the website, according to Jessica, and by my own research, and I had to request a public records request in order to get the audio from the June 9th meeting.
I apologize. Dave, do you want to take us deeper into the details of this?
Sure. We record the audio of these meetings and then reduce it to a transcript, or well, almost a transcript. We reduce it to written meeting materials. We haven't historically posted the audio, and I'm aware that we've had some public records requests and are providing the audio via public records requests. We're certainly evaluating and working on. It seems that there's much more interest in those audios being available without a public records request. And so we're evaluating that shift. It's just something historically we haven't posted the audio as something automatically available after the board meetings, but recognizing that we have had more public records requests related to receiving the audio file after it is transmitted to us. That's something that we're looking into being able to provide more upfront, again, without having to make those public records requests. But I do know that we do audio record all of our board meetings, and we do have those files because we use them for creating the minutes that are brought back to the board meeting for approval. So the audio is recorded for these meetings for each of them, and we can work on making them available without needing a public records request. I'm not sure if I've answered all the questions.
Can you turn this? Could you hit the button that allows the live transcript to occur so those people who are hard of hearing can participate meaningfully in the meeting?
I'm not sure about the technical abilities at the moment. I'm looking at. I will contact our IT department to find out. I know that there are sometimes limitations once a meeting is active as to what can and can't be done. But let me reach out to our IT department right now while Sue takes us into the meeting to figure out how fast or what we can do.
You have maybe 100 people here in their 70s, 80s, and 90s. And they're here because they've learned their insurance will be stripped away from them. You knew we were all coming, and you should have known that many of us in our 70s, 80s, and 90s are hard of hearing. And you've created a meeting where we can't participate. And I want to formally protest and say that you're violating HCA standards and that you need to do more than just say in the future we'll look into it. You need to do what you need to do to provide those transcripts so the hard of hearing people can participate. It's a matter of right, not a matter of privilege. We have a right.
Thank you for that comment. And I can't recognize your name. You come up as Karen B. So could you please, and you're muted now. So for everybody listening in, first off, there appear to be about 60 people that joined late. I'm Sue Birch. I'm the chair of the PEB board. We have already announced that we are not taking any action on the UMP Classic vote today, that is being put in a different pathway. So we have in the past not been able to do closed caption, is what I think you're referring to. Now, we have made available the audio recordings when we have Open Records Act, and we're going to need to continue to proceed on because it's really important that we make live insurance offerings, and so the board has some activity. So we hear you. We will absolutely work with the technical team to look at how Zoom can put up closed caption. I have not witnessed that in COVID era. Now, I do know there are features on people's individual computers that can convert, but I have not seen that in any meeting that I've been in since COVID has happened. But we will absolutely commit to investigating how we get more ADA compliance with that live closed caption feature. All right.
Can I just reassure people, you noted that there are about 50, 60 people who joined late. There's no action scheduled for 2022-12 today. There's no plan to bring that closure proposal back this board season. That ends in July. There's no plan to bring that closure proposal back this fall. There's no plan to bring that proposal back in 2023. For those who weren't here for the opening comments, I just wanted to make sure that that was as clear as possible.
Thank you, Dave. So what I'd like to do at this point is move us to the next agenda item. This is the UMP RFR 2022 for benefit year 2023 and UMP benefit resolutions for action. Christine Davis, who is our UMP account manager in our ERB division, is bringing back 2 resolutions related to the UMP CDHP offering for action. And then she's going to introduce a new resolution.
They're going to start now with the presentation.
And I would ask, if you're not a board member, to please mute yourself. So this is about the UMP CDHP offering, And she's going to introduce a new resolution about the UMP accumulators with action scheduled on it for the next board meeting. So after Christine reviews this resolution for action, I'll read the resolution, and then I'll ask for a motion to adopt and a second. I will invite public comments specific to this resolution, and I'll ask for discussion from the board until we are ready for a vote. After our votes, Christine will introduce a new proposed resolution, and her materials are behind tab 3. And again, for clarification to the public, this is about UMP CDHP, not UMP Classic. Go ahead, Christine.
So I just want to, Leanne had her hand raised, and I don't know if it's still raised or not, but she did have her hand raised, and I wanted to.
Thank you, Dave. It's really hard to monitor like almost 300 of these boxes. Go ahead, Leanne.
I'm sorry, that was a mistake if that was me, Leanne.
A different Leanne. Thank you, Chair Birch. I guess I would just like to state that as I was listening to that open statement, that was read by staff, I think it beautifully captures the importance of the transparency and deliberate consideration of the facts before major decisions are being made by a board. And so while that statement should be able to stand, I really think it's important, especially for the trust of stakeholders, our board, and the talented staff who are also getting inundated, right? That we codify that intent of that statement in a motion as follows. That PEB board postpone consideration of resolution 2022-12 until at least January of 2024 to allow staff the opportunity to interact in a meaningful way and in earnest with the stakeholders impacted by such possible decision.
So Leanne, thank you for that, but we are dealing.
Chair Birch, parliamentary point of procedure, Leanne has made a motion. I think you need to call for a second because she has put a motion on the table.
Thank you. Can I
second.
Thank you, Elliot.
I second.
So could I ask for the board to have further discussion about this? Points of clarification? And Dave, it's my understanding we were going to work on the details of Christine's information and deal with the proposal about.
It is, but from a parliamentary standpoint, a motion is on the table that has been seconded and I believe needs to be debated. Michael Tunick, please help me out here as our parliamentarian. But I did hear a motion, I heard a second, and I believe we're up for debate or comments from the board on that motion.
So again, I'm a little confused because Leanne's motion is not specific to what Christine was proposing.
They are killing our health insurance. So now we have to.
Excuse me, I'd ask for who's ever speaking to please mute yourself. And Leanne, your hand is up. Go ahead.
Thank you. I just wanted to confirm that my hand was raised prior to this, before the staff started the presentation. And I understand that you did not see that. So then I was going to lower my hand and wait for another opportunity, but then it was raised to your attention that my hand was raised. So I understand and I will defer to the parliamentarian.
Thank you, Leanne. So as the chair, I'm just trying to understand the timing of all of our business because I believe your motion is out of, you can bring a motion anytime, but I don't believe it relates to what we are discussing. Dave, can you confirm that, please? And with our parliamentarian, can you please assist?
Michael Tunick, my question for the parliamentarian is, this is a very important question that a lot of people are standing here listening on this call. I posture, and I'd love your confirmation that given Leanne raised her hand before the conversation started, and I brought it to the attention after she began the presentation, if it's the chair's discretion as to whether to hear the motion now or to wait, and then leave it to the chair's discretion on the timing of it. Your thoughts, Mr. Parliamentarian?
Yes. My thoughts are that the motion is what brings business before the board, and so at this point there's not another motion on the table. And so, although I know that we wanted to have a particular topic on the RFR procedure, I think that Leanne's motion does bring business before the board, and so I think it's the Chair Birch, you can, ask her to table it, but yeah, and bring it up at, a little bit later, but it does seem as if it is within order.
So for board members that might be a bit confused, I believe Leanne's motion is related to our business that we were going to do in about 3 agenda items. Leanne, and I don't see what you verbally stated. If staff could actually type that out, that would be helpful too. Or if you could repeat the motion, because we absolutely aren't, we're just trying to understand what you have just thrown out and the timing of it. Because there's, as you know, different pieces of business today. UMP Classic Retiree is its own bit of business. So Leanne, can you clarify?
Absolutely. Thank you, Chair Birch. For clarification purposes, I was prepared to make that motion later in the agenda. My concern was with very clear tension with the folks that are joining us today and raising concerns about ADA and there being a concern about potentially protesting in general. I thought it was imperative that with mention at that point that there may have been people who missed the statement that was read at the beginning of the meeting, and that I felt it was critical that people understood immediately that not only is there a statement, that let's codify that into a motion so that nobody has any reason to distrust this board or our staff. And that I think it's a motion that could help start the healing with the decision that is going to be discussed later.
Thank you for that clarification, Leanne, and I certainly understand. I just want to make sure with our parliamentarian, since we have an order to the agenda, if we were to bring this issue forward, will we be in any way creating any sorts of bad intent? Is there going to be any problem if we flip the order of business? Because
I understand, Chair Birch. Yeah, okay, I'm not, okay. Yeah, I understand what you're saying, Chair Birch. I just because I think she's okay to bring this business before the board now, based on just because it's not otherwise a motion or other sort of action on the table.
Okay, so board members, Dave, can I ask if staff is there any way for us to put up the proposed motion? And or Leanne, if you have it written, could you repeat one more time for clarification for the full board?
Jessica, I'm going to ask Jessica to type it into a Word document, and if you can pull up a Word document so that you can make sure you're capturing it, Jessica. If we could just wait one moment while Jessica steals the screen and shares. And Jessica may be anybody. It might be anybody on our admin team.
Thank you. And Leanne, I really appreciate you bringing this forward. So we're just trying to get the flow and get things together so that.
I apologize that I was not seen right after that comment where it was maybe a little bit more clear and pertinent to the comments that have been made.
It totally understandable. And for members of the public that have not joined us, there's all sorts of plans that we vote on. And the one I think that people are most interested are confusing that on our agenda. And so again, we're just trying to make it very clear because we are not taking action on UMP Classic.
Correct.
It looks like we're shifting to a real-time screen, but we're not seeing a document yet, team admin.
In the meantime, I see that Monica has her hand up. Monica, do you want to go ahead and make a comment? Monica's a board member.
Yes, I do. And I think it's really important that, first of all, we acknowledge there's 285 people on this call. and I'm very grateful that they have joined the call. Second of all, I think it's very important once now that a motion has been made and that it has been seconded, if this is the piece for discussion, I would like for the parliamentarian to also clarify that there is there an opportunity to be able to include either an edit or a caveat to what's been proposed.
Thank you, Annika. So Michael, that from the Attorney General's office, that's being directed to you. And I believe, Monica, because we are in discussion of the motion to adopt in the second, and that we're still trying to work out the details because we're waiting for it to be written on screen real time, that we will be able to
Yes.
amendments.
Yeah. So that's I would agree with what you're saying, Chair Birch, that the motion is now up for debate after having been seconded, and I definitely like the idea of getting it written down so that everyone is very clear about what we're talking about here. And then, yes, if you want to, the form would be an amendment to add or modify text, and that can be done during during the debate. You can propose amendments.
Jessica, could I please ask that you enlarge the font on what you are typing? I think you're at 16, and if you could go even a little further, that would be great. Okay, so Leanne, I think we are ready for you to dictate, if you will, real time, the motion that you have proposed. Thank you so much. And that way I think we'll at least have visual for those that, and audio for those that are listening in and or can read the screen. Go ahead.
Absolutely. That PEB board postpone consideration of PEB resolution 2022-12 until at least January 2024 to allow staff to interact in earnest with stakeholders impacted by such consideration.
Thank you. So again, for members of the public, Leanne is a board member. She has made the motion, and we had a second by Elliot Weinstein, and we are getting this in writing on the screen. And I'm calling now for board members for further discussion of the proposed motion. And again, we're out of order on the things that were on the agenda, so I just want to clarify where we're at right now. And I appreciate this, Leanne, because I think it is, we're trying to make it clear for members of the public. Are there any board members that would like to continue the discussion or ask questions of Leanne? Or any friendly? Go ahead, Monica.
This is Monica. I would. I believe that we should have an additional statement. I appreciate the intention of this statement, but I would like to have some language in it that will contextualize the notion that because we are talking about Medicare plans, knowing that we have we're in a very interesting political time, that we may have an opportunity to revisit this. So I would like for there to be some kind of language that we could revisit either this timeline or an opportunity to bring this discussion forward, because we do have midterm and presidential elections in this timeline.
Thank you for that, Monica. So I just want to, Chair's prerogative, I want to better understand this. So I think because you are suggesting that Medicare is a federal and a state program, state in the way that our legislature creates subsidies for our retirees, you would like a sentence added that says that we will be mindful about the midterm and the presidential elections, in order that we might have to take action one way or the other, given unforeseen things that could happen at the federal level. And specifically, Is that correct?
That is correct. Thank you.
So if, for example, the federal subsidy for the managed care plans went away, or if something happened at the state legislature about the subsidy, or something happened in the transformation journey, you would like it codified that we are taking these things into consideration. So Leanne, I see your hand up, and how are you reacting to that amendment or suggestion?
I agree with the intent behind it. My concern is it weakens the statement that I believe needs to be made very clear. And I guess I would ask the parliamentarian maybe to weigh in on if this were to pass as written, and there was something that occurred that had impacts, politically based on federal or state level. Would the board not at that time, based on new information, have the ability to create a new motion?
So you could, and I actually wanted, just as a point of parliamentary procedure, I realize that, and we're all within proper procedure here. We're actually, I realize that until Chair Birch reads or states the full resolution, we haven't stated the question, and so and that's when debate formally starts. And so so the point I'm making is actually at this point, it's rather than going through an amendment, there's really just a suggestion to modify your motion. So procedurally, I'm just saying it's easier at this point to sort of change the text, because someone is just asking you to sort of modify the text, and which can be done before the question is stated by, or before the resolution is stated by Chair Birch, or until then. Now, as far as, yes, this resolution can be rescinded or later amended by the PEB board, and I guess the thing about it is, I understand, sort of the purpose is to kind of bind the board not to act until such time. And so, and so you can add the text in about, sort of maybe to try to at least put in writing the situations in which you might consider it to be appropriate to consider the PEB 2022-12. No, I mean, and so, yeah, thank you.
Okay.
This is Elliot. The problem I see is we don't know what situations can come up. So if you have language that restricts it to a federal change or something like that, it's implied that anything else that comes up won't allow us to change something. I mean, we sat through the COVID crisis, and we had an emergency meeting, and we suddenly came up with new resolutions. That can be done at any time. Monica or anyone can bring that up in an emergency situation and offer that. So I don't think it needs to be in writing, and we might unintentionally limit ourselves by specificity.
Thank you for that comment. And Michael, I'm going to formally state the resolution before us, because I heard you to say that we need it repeated. So for board members, there is a vote before us. And Dave, do we have a number, or how are we sequencing the motion?
If you would like to give it a number for ease of reference later, we'll number it Resolution PEB 2022-16.
Thank you.
If you could add that, Jessica, please, that would be helpful.
Thank you. So board members, there is a resolution before us. It's PEB 2022-16 brought before us by Leanne Kunze. It is resolved that the PEB board postpone consideration of PEB 2022-12 until at least January 2024 to allow staff to interact in earnest with stakeholders impacted by such consideration. And there was a motion to adopt this verbally. And there was a second by Elliot. I believe then we got into discussion to please get it on the screen. In that discussion, an amendment verbally came forward from Dr. Monica McElmore and asking about could we put in language that allowed for more flexibility if we had to act. For example, if there were new federal subsidies that made UMP Classic either way. So I heard her to ask for, could we amend the resolution? And that's where I think we have where we are. And I would ask Leanne, if you would like to honor that friendly amendment, or if you'd like to see something in writing. I think we were crafting that on real time when we needed to refresh on our process.
I believe just based on the circumstances and the communications that we have received as a board and the uncertainty, I think it's important that we keep it as is. I agree with Monica, but I believe it would be best handled in a new resolution should any type of situation arise where the board needs to come back together and have any form of reconsideration. I believe it is critical that we have a very clear message to our stakeholders that this is what we say and this is what we mean with the opening statement that I believe very beautifully I guess captured the essence of what's really going on here. And a statement isn't something that we have to be held to. We could come to the next meeting and there could be a motion about closure. This makes it very clear that the statement that was made was genuine and that we are interested in ensuring the trust of the stakeholders and the respect of our staff, that the board be intentional in making this official. So I politely decline the amendment.
Thank you for that clarification. So given that there is an active motion and a second on the floor, is there further discussion from the board before I ask for comments from the audience specific to this resolution?
This is Monica.
Go ahead, Monica.
I don't disagree with Leanne, and I think engendering trust is very important. And so knowing that future amendments or future motions can be made, I believe my question has been answered.
Thank you for that clarification and for being comfortable with your amendment to the motion not being added. So now at this time, I'd like to see if there are any comments from the audience specific to this resolution. And staff, I'm going to ask you to help monitor.
Right, and Chair Birch, now that we have a motion and a specific piece, the organization that we were doing for this afternoon wasn't germane to a motion, so we're going with the virtual hands we're seeing practice, which may feel disorganized individuals. It's the spontaneity of the motion that's causing this.
Thank you for that clarification, Dave. And I know that later we'll have public comment also for those that still want to remark about the specific UMP action 2022-12.
And Chair, I have staff who are putting the order of hands received, sending that to me. If you like, I could facilitate calling of names.
Dave, that would be great because electronically I don't have that panel available to me.
Okay.
Can you tell us how you raised your hand?
Oh, at the bottom of the Zoom screen, there is a button that shows reactions. It's a little smiley face with a plus sign. If you're reading from left to right, there's participants. On the far right, you'll see reactions. When you pick reactions, there's a raise hand button.
And Dave, while you are waiting to see the lineup of speakers, I just do want to suggest that public comments need to be kept very minimal because I'm certain that throughout this meeting we'll be receiving many. And so again, this is specific to a new resolution, the PEB resolution 2022-16. So please keep your comments focused on the motion that Leanne has forwarded to the board.
Perfect. The first name that we saw was Fred Yancey, and then up next will be Sylvia. So Fred, go ahead and go off my mute, please.
Yes. Good morning, Chair Birch and members of the committee. My name is Fred Yancey, and the only reason I raised my hand is, I believe, and I could be corrected here, that really what the resolution is asking is that the PEB board postpone consideration of the closure issue until January of 2024. And my read of this resolution is postponing consideration of the issue means that there's no further discussion would be allowed on this issue until 2024. And I'm not sure that's the intent, but consideration is not action, it's consideration. So I have an issue with understanding when they say postpone consideration, does that mean, for any further discussion, even, when I believe the intent again is to propose consideration of closure of Uniform Medical. Thank you. That's my only remark.
Thank you for that comment, Leanne.
In response to Fred Yancey's comments, I concur and would suggest an amendment to the language that's on the screen. And as soon as staff is ready for the edits that I'm offering, let me know.
Jessica, are you ready?
Are you calling Sylvia?
Oh, hold on, Ms. Haven. There's a amendment that's about to be proposed to the resolution, but you're next online for public comment. But there's now a amendment, a motion that's about to be made, it sounds like. Jessica, are you ready to capture this?
I'm ready.
Okay, in the second line where it says PEB 2022-12, to strike that and replace it with closure of the UMP, and I may need help with naming this appropriately for the actual
UMP Classic Medicare is the phrase that is used.
Thank you. There we go. Plan, or I think we want to say plan, correct? Or portfolio, whatever word is the appropriate word there. That makes it very clear too, because I think, again, when we're looking at intentionality and, trust, we could just come up with a new resolution number. So I think striking that and making it very clear is wise, and I appreciate the public member, Fred Yancey's comment.
Point of parliamentary inquiry for our Attorney General. The individual, Leanne, made the original motion and is now amending her own motion. My understanding of parliamentary procedure is that as long as Elliot, who seconded the original motion, agrees, then it's simply accepted and there's not an additional vote. Can you clarify if that is procedure or what the next procedure is if that is not?
Yeah, please give me a moment, Dave. I was actually going to ask for clarification on what, just I didn't see the text as it was being changed as far as what is being.
I would like to suggest also inserted. That we show that on the screen of the strike through of what is already before the body, so that you can.
That would be helpful for me. Yeah.
Yep, and then maybe in red ink or in bold ink indicate what is replacing that. I think that's the most appropriate. And I'm not a parliamentarian, but my understanding is that once the motion is seconded, it belongs to the body, and the body would need to vote to accept the amendment.
So while Michael Tunick looks that up, Jessica, can you go before the word closure? It was before the word closure. Add back in PEB 2022-12. And put, nope. There we go. And put a strike through between PEB 2022-12 and yep, and strike through that. And then put an underline the words closure of the UMP Classic Medicare plan. That this follows somewhat more legislative processes. So we're showing the strike through of the original reference to a resolution, and an underlined is the new text that's being proposed. And I think we need to wait for our parliamentarian to provide insights at this moment.
Yeah, Michael, it's my understanding that we can take public comment, as long as Leanne is comfortable, make additions or changes, and then get the board to collectively vote on the public recommendations at the end. Dave, is that your understanding?
My understanding is that there's now a process in place for amending the resolution, and that from a parliamentary standpoint, that has to be addressed before continuing.
Oh, okay. So my reading, and please let me know if you have a different view on this. Ultimately, I'm advising our parliamentarian is the chair, although I know she's deferring to her AAG, is that the amendment has to be seconded, which at this point it has not been, but that if the original motion was one that was open to debate, which it is, that the amendment itself is also open to debate, so that not really the identity of who seconds the motion, but rather just was the original motion open to debate, and the amendment itself is also open to debate.
So Leanne, I seeing that you concur with the amendment, and I'm assuming, Elliot, if you could weigh in, if you are, as a second, comfortable with this amendment, we'll move on to the next public comment. But first, we need to hear from Elliot if you are second to Leanne's acceptance of this amendment change is acceptable to you. Does your second still stand?
Okay, I would like it to, but I'm not sure that the changes address Fred Yancey's concern. What I heard him say was consideration was the issue. He thought we couldn't even talk about anything. That's what I heard him say. I don't believe that's true, but, or I don't mean to put it that way this motion is framed, but I'm just not sure Fred Yancey's concerns have been addressed by the change.
Thank you for that. My reading is that because of the language that said to allow staff to interact in earnest with stakeholders impacted by such consideration, that staff have enough leeway to be able to continue to work the issue throughout this time frame, but that no board action would be taken until at least January 2024.
I agree with you. And I can second the motion. However, I just wanted to make it clear that I did have concerns about Fred's questions being addressed.
But I do agree that the word action would be taking a vote on am I unmuted here? Yes, that the word action would really talk about whether the board can vote on its closure, whereas Fred's concern was that if you say postpone consideration, that sort of takes outside of although I agree with Chair Birch that the staff will still be able to interact with stakeholders, but you're saying that the PEB board won't even discuss closure, and that might be fine. Maybe that's what we want anyway.
So with that, I will second the motion, if that's appropriate at the moment.
Thank you for that clarification, Elliot. Go ahead, Mike.
That would be a seconding of the motion to amend, and so then there's once Chair Birch states the question, then you can actually have discussion. So just procedurally have discussion regarding what is the amendment, and then vote on accepting the amendment. And as confusing as it sounds, then at that point, you haven't actually passed a board resolution. At this point, you've just changed the words of the resolution that was initially proposed, and then you could go back to discussing sort of the merits of 2022-16. So yeah, I'll return to you, Chair Birch, that yes, there's been a second, and now you can state the question and open for debate, and then possibly put the question then to the board for a vote.
And Leanne, I see your hand up.
I'd like to further clarify that when I say, that the board postponed consideration of the closure, I'm talking about formal consideration, meaning it is on an agenda and it is before us for action. That is how I interpret the word consideration when we're talking about board action and the word in the form of a resolution. And so if that's captured in the minutes, I think that suffice to say that staff continues to do the in earnest that would be impacted by such consideration. So I think that would be suffice to further reiterate the intent.
Okay, so let me just bring us back to where we're at. We received our first public comment. From that, the author of our motion, Leanne, accepted or made an amendment to their own motion. It was seconded by Elliot. And I'd like now, Dave, for you to move us, because I don't believe we're going to vote until the very end. I think we want to hear the next comment so we can continue to get our public comment going. Correct?
I can proceed with the list if that's where I certainly. The next person whose hand was raised was Sylvia Haven. And then just for the next person on deck would be Gwen Wrench. So Sylvia, please unmute.
I think that my questions were answered by your changes.
Thank you, Sylvia. Dave, can we move to the next commenter, please?
Yep, the next hand that was raised was Gwen Wrench. And then following would be Larry Zerzan.
I'm sorry, can I just want to clarify, like procedurally, we're still at the point of discussing an amendment, and I believe that the public would be more interested in, sort of being on the part of the debate that sort of talks about the sort of, I guess, the substance of the resolution of postponing consideration. And so I'm not saying that the public shouldn't weigh in on whether to accept the amendment, but I just want to make sure that that there's discussion of the amendment by the board and a vote on the amendment by the board. And then if the amendment is approved, then we go back to the main motion. Thank you.
Okay, so board members, so public, please hold your comments for the time being. So board members, we are going back to this specific amendment, and I would like to call for a vote on this particular amendment to the motion so we can continue on. So board
Stu, I'm sorry to interrupt. Is it possible to suggest one language change that might address that Fred's concern about consideration? It would be up to Leanne if she wants to accept it.
So yes, Tom, you're discussing this amendment, so go ahead and propose your
Okay,
comment.
Resolved that the PEB board postpone action to close UMP Classic Medicare plan until at least January 24 to allow staff to interact in earnest with stakeholders. So it would eliminate consideration and replace it with action to close.
So Jessica, could you please, in a different color, type in what Tom has just suggested? And it's just very hard to do this verbally without seeing it in writing as well. So I think that will help. So this is the discussion.
And so I would say at this point, the chair has not yet quote unquote stated the question to put it before the board for formal debate. At this point, we're discussing sort of modification of the motion to amend. And so at this point, I guess Leanne can accept that modification and of the motion to amend, and then we can go to debate on the motion to amend with the language that has been put in there. And I'm just sort of saying it this way because, again, you haven't formally stated the question, and so procedure that would actually be simpler than having an amendment up for discussion and then a second amendment to the first amendment to the motion.
So, board members, we're going to stick with the first amendment. I see Leanne's hand up.
And if I'm understanding the parliamentarian correctly, because I'm the maker of the motion, I would be able to say, I would like to further ask staff to strike consideration of and replace it. I'll let you do that, where you'd be putting that in red and strike through. Consideration of, so both words.
Bravo. Alpha, Charlie. Hello.
Okay, and then yep, where you are now, where that's underlined, you would insert action on. And then in the very last part, putting a period after stakeholders and striking the remainder.
So in our discussion of this amendment, the author, Leanne, has made friendly changes to her first amendment. And Michael, can the board continue to discuss these proposed changes? Since it
and so I know it's what I would be great at this point is it looks like Leanne has accepted the modifications that were proposed, and so at this point, if it's not formally been open for debate until you state the question of, it has been, a motion has been put on the table, and a second to amend the proposed resolution and as follows, and maybe, to delete these words, insert these words, delete these words, and then at that point you can open it up for debate. And so I know
so we have before us.
On
Thank you, Michael. We have a motion on the table, PEB Resolution 2022-16 by Board Member Leanne Kunze. Resolved that the PEB Board postpone action on closure of the UMP Classic Medicare Plan until at least January 2024 to allow staff to interact in earnest with stakeholders. And we have this motion to adopt. Elliot, I'm going to clarify that your second still stands. And
yes,
so
it does.
Thank you.
And this is just for the amendment, so it's not the substance of the resolution. It's just the amendment, so that you're gonna, I guess you'd say, effectively change the wording of what the original motion is. And so we're not adopting the resolution.
That's correct.
To postpone closure action, but we're adopting. We're going to vote on just changing the words through amendment.
So that is correct. So at this point, are there any comments from the board to discuss the amendment changes to the proposed resolution? Is there further discussion or comments from the board? because if I'm going to call for a vote of the amendment so that we can move back to the full motion. All right, I'm going to do a roll call vote just so we can make certain we have clarification. Again, board members, this is for the amendment. Harry Bossy.
Oh, yes.
Scott Nicholson. Elliot Weinstein.
Aye.
Monica McLemore.
Aye.
Tom McRobert.
Yes.
Leanne Kunze.
Aye.
Sue Birch, I vote in the affirmative. So our amendment to PEB Resolution 2022-16, and I can read it one more time if need be, but actually I don't think we need to, passes. So let's go back now to the public comment, the second person in the queue, Dave. I'm sorry, third person, because Sylvia already commented. Dave, could you please take us back into the lineup of comments for this particular resolution with these amendments?
Yep, and Jessica is correctly eliminating the now, is making the motion as amended appear on the page that is viewed by everyone. The next person who had raised their hand was Gwen Wrench. And if Gwen, you take off your mic and speak, and the next up would be Larry.
Well, at this point, I definitely support this resolution and I appreciate it being made. So that's all. I had lowered my hand, but I guess that didn't get noticed. So thank you.
Thank you, Gwen. Larry?
I'd like to clarify the question here is that I support the resolution too, but is this a time for me to talk about the elements of this process as well as the policy content?
Larry, I'm going to ask for us to stay focused on this motion with these amendments, and we will capture your comments in the public comment period, or if they are specific to other published agenda items, we'll capture them then, and thank you in advance for your patience.
Okay, then I guess the other point about this resolution, and maybe it was part of the amendment process which was dropped, which is that I think you need another resolution calling for the state of Washington's legislative affairs folks in Washington, D.C. to pursue the correction to the adjustment to the current CMS rules that have caused the drug-related problem to begin with. Thank you.
Thank you for that comment, Larry. We'll note that. And again, you'll have ample opportunity later in public comment to revisit that. Dave, our next respondent.
Yes, the next person, and I'm going to call everybody in the order that they were received. Their hands may have gone up and down, but the list I've received next was Don Boxford, and then just on deck next would be Marianne Wilkins. So Don?
Do pass.
I'm sorry, Don, I could not understand that. Could you repeat?
Do pass.
Oh, please do pass.
Please do pass. Thank you for that comment.
Marianne Wilkins and then Joan Goldblatt. Marianne?
I pass too.
Okay. Joan and then Edward. I don't have a last name, but Joan Goldblatt.
I'm here. My question is a point of order. I do support this resolution. If it refers back to 2022-12, that in part endorses the plan premium for 2023, and so which also gets endorsed in 2022-15. So just a point of order, if this 2022-16 pulls 2022-12 off the agenda, and then the premium is endorsed in 2022-15. That's my comment.
Thank you for that comment. I think we have sufficiently prepared for that because of the way the agenda is proposed. So staff have accommodated that split, anticipating that this postponement.
Right. Thank you, Joan. Next, I have Edward, but I don't have a last name. And then I have Karen B, but Edward was the next hand that was seen as raised. Edward, are you still here and wanting to speak? You may be on mute. I will add you back to the bottom of the list in case there are technical challenges. I'll ask Karen B, and then next up would be Joanna Standish. Karen?
Hi, I'm actually John Borg. I'm using my wife's computer.
Mhm.
I support this amendment. I really appreciate it. I think we have to look at how we got here with almost 300 people on this Zoom meeting. I was never notified of this change by the Healthcare Authority or by PEBB. I found out about it only because two retired teachers, Mary Lindsay and Tom McRoberts, sent out an email to people they had addresses for, and they told me about it. They sent me by email a copy of a two-page flyer from the HCA dated June 15th, only 2 weeks before action was going to be taken. I never received that flyer, but even if I had, it would only have given me 2 weeks' notice. I've read the May newsletter from PEBB, and it talks a lot about the Uniform Medical Plan and about its availability to retirees. But the May newsletter didn't say anything about this change, even though it was clear that the staff was considering it and talking about it when the May newsletter was written. What's happening is that there is a real lack of trust because the agenda until just today had voting to kick us out of UMP, and no public notice was given. And this will give the PEB board and the Healthcare Authority a chance to fully notify those of us whose insurance is at risk. So I support this. I wasn't notified about any of this, and that was wrong.
Next, I see I had Joanna Standish. And then as we look for Joanna, the subsequent is, I don't have a name. It's the individual who's calling from a phone number that ends in 7019. But Joanna?
Yes, thank you. I appreciate the opportunity to give input on this. I do support this resolution and thank Leanne for making it and Elliot for seconding it and the rest of you for voting for it. I do have a question that I think is most appropriate later. Interacting in earnest with the stakeholders is definitely part of what I would like to see, but I would also like to see something specific that addresses education and analysis of plans so that individuals can make the best possible decision. If that's what is intended by interacting in earnest, I'm very happy with this. I thank you for your support.
Thank you. The next number I saw was somebody calling from a phone number that ends in 7019. And after that individual, I have Mike Wiseman. So the individual on 7019. And you may be on mute still. I will come back to 7019 as well as Edward. We'll go next to Mike Wiseman. And then I have Fred Yancey, who's raised his hand again. Mike, please unmute.
Well, hello, I unmuted myself. Can you hear me?
Yes, please proceed.
So as I read the resolution, I think it's good as far as it goes, but I'd ask Leanne to consider whether it needs this. There's nothing in this resolution that describes to what purpose the interaction is to take. In other words, what are the standards that we will measure any future decision against? And here's where I'm coming from. I would argue that the purpose of PEBB, at least in regards to retiree insurance, is that retirees have the best possible benefits, the best possible insurance available to them. So I would want to see staff interact in earnest with stakeholders to the purpose of achieving retiree insurance coverage that's as broad and as inexpensive as possible. I'm not sure that the staff has the necessary direction, and there are obviously things going on in the background that I don't know about. Staff has the necessary direction so that they know what their purpose is when they develop a communications plan and action plan in terms of taking comment and so forth, looking forward in this process. Because this little bump in the road today should never have happened. It was completely avoidable. And we want to see that it's avoided again in the future. And end of transmission.
Thank you for those comments. Dave, can we move on to our next commentary?
Yes, our next hand, and it was Fred Yancey, Fred, and then I'll go back to individuals who had not unmuted their mics. And Mike, and I'm sorry, I already can't remember your name, who's using your wife's Karen. If you don't have another comment, if you could take your hands down, that would be appreciated. I think it was Don, if I remember right. But Fred, you're up next.
Thank you. This is Fred Yancey again. I'm sorry to be up again. I don't mean to be too picky, but this change is the same problem. I have the same problem with the proposed action as I did with proposed consideration. To discuss something is an act. So, you're to continue discussion. Really, simply put, I believe what member Kunze wants is that resolved that the PEB board postponed closure of the UMP Classic Medicare plan until at least January 2024. I think that's simply what you need, what you want. And again, to allow staff to interact in earnest with stakeholders. I have an issue with the word action. Does that mean you can know, discussion is an action? And maybe I'm being too technical. Chair Birch, I appreciate your earlier.
I'm sorry for interrupting. I'm sorry for interrupting, but I would like to point out staff who's sharing the screen. I don't think that your intent is to share that publicly right now.
Thank you, Leanne.
Chair Birch, your earlier interpretation of the, of the previous version, I believe is correct. That the intent is to continue the discussion, but I just, again, I think I made my point. I have an issue with the word action. Thank you for taking my remark a second time.
Mm-hmm. All right, I'm going to go back. There was an Edward who I didn't have a last name who had indicated an opportunity wanting to speak, but lowered their hand, and I just wanted to check again if there's an Edward who wanted to speak.
Yes, I do. I agree with the last speaker. I think that pending something that has a as a result, a closure is an action is going to happen in that fashion. So I am not in agreement with that. I think we should support the benefits that we have. The insurance plan needs to be modified so the cost of the drugs results in a reduction in the premiums and it benefits everybody. But I believe the program that we have
Thank you, Edward. I'm going to call now for the next individual whose last name number was 7019. If you wanted to provide public comment, and then next I saw Ian's hand, but 7019, I want to do another call for public comment.
Dave, I think they are not on. And I would ask again, Fred, and also Don, under Karen B's name, to lower your hands. If you do that under the reaction, and when you click on that, it'll say lower your hand. And I know, Leanne, your hand is up. I think, Dave, we are done now with the public comments. Is that correct?
Well, I think John is
asked
me to speak. I say John raised his hand a second time.
Okay. Trying to clarify. Thank you.
Perhaps John raised his hand before Leanne. John, would you like to go, and then we'll turn to Leanne?
Yeah, I do, like as I said before, appreciate this because I wasn't notified at all. I don't think maybe any of the people who are on this Zoom were notified. I want to say that I think that between now and January, you should notify us, the retirees, UMP Medicare retirees, by sending us at least 2 letters by US mail, and by sending us monthly emails, and by featuring the proposed change on your websites and in your newsletters. I think you should hold listening sessions across the state and by Zoom. And I think you should provide a dedicated phone number so that the 40,000 of us who are in danger of losing our insurance can call and interact with a staff member who's trained and get the information that we need by calling. There's a lot you could do to let us participate in a big change in our lives. And those are things I think you should do between now and January. Thank you.
Thank you. I would ask any commentators to please, we're taking comments on the amendment and the resolution that on the screens. Oh, thank you. And we will have public comment period in a bit.
And Sue, before we go to Leanne, I see the individual on 7019 has now come off mute, and that since I've called on them twice, I'd like to give them the opportunity to speak before going to Leanne. So the individual on 7019, please go ahead.
Yes, my name is Diane Rauschenberg. I am a 40-year retired state employee. I retired in 2016. I worked at the state school in Buckley in various positions, and I'm requesting that the PEB board continue to allow us to do listening sessions to inform the healthcare about our choices. I had the first 3 years I worked for the state, I had Blue Cross, which we paid no premiums, which was amazing. And then we made a choice, and I've had Uniform Classic Medicare for 37 years. And I'm just wondering that we want to expand our health choices and look at other options. And I know Medicare is stressed, and so is everyone. And we'd like to see ways that they can reduce the income and the amount of money paid for prescriptions and so on that would help us with this program. But I think eliminating the UMP
right around the mailbox, because that's where they're really giving me a hard time.
Excuse me, I don't understand why I'm being interrupted.
I'm unclear either. We're going to mute other members who aren't speaking. If you could continue. Thank you. We've muted other participants. Okay. Please continue.
Okay, I would just like to see if they eliminate the UMP Classic Medicare and not offer a traditional Medicare option, it disrupts and complicates access to quality care for state employees and the most vulnerable seniors. And I am one of these people. I'm 75 years old. I've had some health problems, but I went to work for the state with the promise that I would receive at the end of my career, because I stayed for 40 years, that I would get some reasonable living expenses with my retirement because I worked hard. And I also feel that they were going to promise me good insurance. And when this goes away, I really feel that the state, and I understand the economics of all of this, but they really need to consider what they're doing to these long-term state employees that stayed and worked for 40 years, their whole life in their career. And now they could be bankrupt. I have a brother-in-law who's 62. He just had a massive stroke. He's not even eligible for Medicare, and they're denying him any of her services. He has a different insurance, but he's in the same boat. I also have another friend who is a state employee whose son just died. He's 52 years old. He did not get any adequate insurance, and the cardiologist had pleaded with them to help him, and he just died last week. And she has to face living with no son now. And I think it's a shameful thing that we don't look and value our state employees. And I've asked the governor already, how are you going to retain and recruit quality employees if you're going to renege on a promise you made to them after 40 years? It was sort of like the golden carrot. I'll get a retirement check so I don't have to go on welfare. And I'm also going to have insurance so that when I do get ill, I'm not going to have to worry that I'm going to lose my home, my house, and be on the street or living in a car because I couldn't pay my medical bills. And I've paid up all my savings and my money's gone because I had to use all my money to pay medical bills because I didn't have insurance. And that's my question to you. I want to thank the board. I know this is tough times for everybody, inflation on everything, gas, you name it. But I think the long-term state employees that stayed the course and did their jobs well and were public servants and cared about, in my case, vulnerable adults at Rainier School, and it wasn't an easy job. I think that we should be given what we were promised. And I want to thank you very much for your help and your time. I know you've got a tough decision, and there's no real easy answer, but I'm asking you to delay this decision. We've got 53,000 state employees that have chosen the Uniform Classic Plan. I think it's only fair that we give them the opportunity to be informed, like a lot of the speakers before me said. We just found out about this 2 weeks ago. It's a difficult decision. I think we need to have some influence with the stakeholders and the other state employees that will so negatively affect. Thank you so much for my time.
Thank you. Leanne, you had your hand next, and then I believe it was Annette Barca, but your hand's down, but I'll check in with you. But Leanne, you're up.
Thank you, Dave. I just want to acknowledge the reality of the impacts and what everybody is saying. And I just think it's amazing how many folks are here. It says how much this topic matters. And it's great to see so much participation. I would like to also, I think, again, so this is captured in the notes as far as intent, especially because I know we didn't have 308 people on our last meeting. In the last meeting, I had made a request, and it is documented, and it was agreed upon that the staff would be bringing back to the board a detailed plan of how they would be interacting with stakeholders. And this was based on like if it was going to close, right? And like it was already, we need to make sure there's conversation, listening sessions, education, all of that. So what this resolution says is exactly what you guys are talking about. In addition to when it says to allow staff to interact in earnest with stakeholders, I truly trust the staff are going to bring back that comprehensive plan to the board for feedback and input of making sure that it is measurable and access and all of the things that are necessary to ensure that when I say interact in earnest with stakeholders, that when it comes back to the board, that I'm going to be convinced it meets that, and that my fellow board members are going to be convinced. And that I just want to reiterate that that is already something that has been asked of staff. And I very much believe in and support the work of our staff. Our board, our HCA, our state could not operate without staff. My role as a board is limited, and I believe in the staff. So I just want to make sure that that is also caught for the record, so that it's codified and understood that there's no doubt in my mind that the intent of what is written on resolution 2216 before you will occur and be measured.
Thank you for that, Leanne. Dave, I think we're going to move on to 2 more public comments, and then I see that Elliot has her hand up.
Yep, I saw Annette Barca. I'm not sure if she lowered her hand, but I want to check in and see if Annette, and I do apologize for everyone. If I have said a name wrong, I do apologize for that. And I'm sure I'm going to meet many of you I'm going to meet many of you soon. I'm positive of that in forum. So Annette, do you have a comment?
Not on this motion.
Thank you. Kimberly?
Yes, thank you. My name is Kimberly Chabal, and I'm a recently retired individual. And I took uniform because that's what I had for my many years of service. And there's something that I found, while I appreciated Ms. Kuhn's remarks, your last remark, Ms. Kuhn's, was that you believe this is going to go forward, that this will be moving forward with the work of the staff. And there are 2 things there that concern me. One, I believe it's a discrimination issue because you're targeting, there are 2 protected class of citizens. I'm talking a legal definition, and that's children and seniors. Right. And when you eliminate only the retirees, you have now targeted, literally, with discrimination, seniors. I don't want to see this go forward. I absolutely know how dedicated staff working is. I get that. I was a worker. I was dedicated. Everybody that I worked with at DOL was very dedicated. Not the issue. So I don't think that's the issue here at all. But I do believe very strongly that this is a violation, one moment if I could finish, of discrimination against seniors, because no one else is targeted here by this. We are. And one of the things that I took this plan for, I don't want another plan. And why don't I? I can't get the number of acupuncture, chiropractic, and massages. Though that is my wellness plan. I generally don't go to the doctor except once a year to get a blood test and make sure everything's good. So I'm not a big user of the services except for those particular services. And this year, you increased chiropractic from 10 to 24. You increased acupuncture from 16 to 24. And you increased massage from 8 to 10 or 15 to 24. Those changes were huge changes and a great benefit to me and other people who use what you would say is, it's a path of wellness really that I use my medical for, not for operations and different things like that I'm lucky I don't need. But I would like you to address how it is possible to single out only retirees who are a protected class of citizens to remove them from this service. I don't believe that's legal. Thank you so much for your time.
Leanne, I think you want to provide clarity on your comments. And so then as a kind of a first, go ahead, Leanne.
I very much do. Thank you. And I believe it was Kimberly. I just want to make sure because the interpretation that you provided couldn't be further from the truth. There are two things, there are really kind of two prongs of this motion. And when I talked about trusting staff and staff proceeding, it is with that last phrase of the motion before you. And that is to interact in earnest with stakeholders. And what I envision and what I talked about in our last meeting was in coordination with organizations that we know represent retirees who are stakeholders, and that it would be in coordination with those organizations to have listening sessions, deep dive education into the things that are impacting Medicare costs. Everything you say is correct. It's not right? Like we have a problem in our country, not just here in Washington State. And so when I was speaking about staff doing good work and trusting the staff to do this work, and also trusting the staff to come back to a future meeting with the plan of how they will be interacting in earnest with stakeholders, such as listening sessions that ensure accessibility, that is what I was referring to. So I want to make sure it had nothing to do with staff moving forward on anything to do with the plan itself.
Thank you for clarifying that. I appreciate it. And
Absolutely.
I think one of the issues is not just availability of staff to have valuable interactions with stakeholders. I think all of that is wonderful. But I think in the end, it's about the actual impact of the decision you're making here on seniors to eliminate. And I pay a great deal of money for these particular benefits, but I chose that because they were what I use as my wellness plan. So it is my deepest hope that I am not going to find myself without a plan. Thank you. That's this plan. You're still continuing the uniform classic, but removing retirees is, to me, discriminatory. Thank you.
Elliot, you had your hand raised next.
Yes, I am a little concerned now, given all the discussion about the term earnest. I'm having read over, I think, over 100 letters these past few weeks, and also hearing from small businesses who are providers that are the lifelines for senior citizens that can't afford to work with behemoth corporations that wait half a year to pay them. I'm really understanding that, although yes, staff is wonderful at giving us pieces of paper and showing how much things cost and the cost to the state. And if you read the statute, it says HCA's job is to save the state money. That's it. PEB's, the statute says PEB's job is to, yes, have reasonable cost for healthcare, but to provide comprehensive healthcare. And what I learned from all of the members, all of you people out there, is what is comprehensive medical care. It's not delaying medical care so that you die before you can get the care you need. It's not a lowball, negotiation number to the state that says, great, let's have this cheap premium. And then you can't, and your provider can't work with the insurer because they don't get paid. And they're not big companies. They're small proprietorships in many cases. That's not comprehensive health care. And that's PEB's job, is to provide that. That's not HCA's mission. They, under the statute, need to save the state money. So what I'm saying is, interacting in earnest is not only listening to these people and showing them your paper cost savings, but having these members have an active role in making the decision, having input in the decision, and changing the decision to reflect the reality of small business that we deal with, and our employees, our retired state employees who were promised a meaningful benefit when they hit an age, and they can't afford, just like these small businesses, to fight a behemoth company that's going to delay a decision in their case or deny it. And it's not just me saying this, it's OIG. And then the other argument I've heard from HCA is that, well, you have Medicare that's deciding when these decisions have to be made. But OIG, as reflected in an April 28th New York Times article, pointed out that they are very disappointed because Medicare does not adequately monitor the speed with which decisions are made, approvals are made, or denials are overturned. And people die. People are going to die. No matter what your pieces of paper say, my members know they're going to die. And to me, that's reality. So we need to have a real voice in this and help make your decision.
Elliot, thank you for those comments. I'd like to move us to our final four in attendance on the public comment. If you have spoken up before, I'd ask for not repeat comments. We're taking comments specific to PEB Resolution 2022-16 so that we can call for a board vote and then move into our formal meeting. So can you help me, Dave, who is next in the queue?
Yes, it sounds like you're saying you want to finish the have public comment from the four people who've raised their hand. That's Jose, Joyce, Larry, and Pamela. Jose, please proceed. You may be on mute, Jose.
There we go. Can you hear me okay?
Yes, please proceed.
Madam Chair and board members, my name is Jose Palmas, Vancouver, Washington. I appreciate the resolution. The word that I'm focusing on is stakeholders. I guess I have not seen I've been retired for a few years, and I really haven't seen myself in that way. And I appreciate that word. I like it. It means that I've got something valuable and something that's invested. What the email that we got about this didn't make me feel like a stakeholder. It was like it made me feel more like an afterthought. And I like the wording. I like the word about interacting, and I appreciate being a member of the RPEC. But I also want to know how I can be more connected to the PEBB now that this has come front and center in my radar. I want to be a stakeholder, and I want to be valued. So please, Leanne, thank you so much for sponsoring this. And I think you hit the nail on the head when talk about how staff are going to interact. I would like to know more about that when you do have time to address that.
Thank you for your comments, Jose.
Mm-hmm. Joyce?
Hi, my name's Joyce Bashford. I'm
pre-retired. I'm not actually retired yet. I feel like some of the comments have gone to what should be done later, and I'm hoping we can go ahead and have you guys finished up the comments and vote on this amendment to the amendment, or I've kind of lost track. Thank you.
Thank you for that. Dave, next in the queue.
Next in line was Larry.
Yes, in order to be courteous here, you were having conversations about policy and future actions not related directly to the resolution. How far off are we from having that having that opportunity to discuss with you problems with the process as well as the policies?
Larry, we are focusing on PEB Resolution 2022-16 before you. We will get to those public comments at the end of the meeting during public comment period.
So we're talking about 3 hours?
That's correct. Towards the end of our meeting. Thank you for your patience. Could I please get the next respondent in the queue, because I'd like to move through these final comments. And if you've made comments before, I'd ask you not to repeat. Go ahead.
Pamela.
Hi, I'm Pamela Woodruff. Can everybody hear me okay?
Yes, proceed.
Okay. I'm a retiree PEB PERS 2 program from combination hours worked at Harborview Medical Center and University of Washington. I have been a medical social worker for the past 20 years. And when I learned that I had the Uniform Medical Plan as part of my benefits package, I was finally able to retire with the relief that I wouldn't be facing medical bankruptcy. While I was working in clinical settings, I saw what happened to people when they had gaps in their insurance. The caregivers who came to me for counseling for the stress about their loved one who had dementia, lots of medical problems, medicine, and so on. I saw the net effect of not getting comprehensive medical care. I thought I would be able to relax into this. Now, I'm not retired from working. I'm a mental health therapist working from home by teletherapy, and I am just so discouraged and appalled that this benefit could be taken from me. I don't want to go with Kaiser. Years ago, I almost died from.
Pamela, if you could keep your comments focused to the resolution, which talks about postponing action on the closure of UMP Classic.
Yeah. Okay. So yeah, postponing action, totally agree with that. I'm concerned with the wording of this resolution because it really only speaks to, they just want to listen to us. Yeah, I'd like to give public comment, but I do want to be a part of the change. I'd like stronger wording for this resolution to be more of an advocate for us. Thank you.
Thank you for your comments. Dave, I believe we have two that haven't spoken yet in the queue. Could you queue those up?
The two individuals are Kimberly and John, I believe.
This is Kimberly. It's not a repetition. I just wanted to say, in terms of postponing, I realize that that's what's before you. Yes, it clearly needs to be postponed and no action taken. But I'm also recommending that it be struck down and removed completely so that retirees are not facing exactly what you're hearing here today. And one more thing, when you're new to this, and I chose this because this is what paid my providers. My acupuncturist, Rain Delvin, a stellar human being and very skilled acupuncturist. She took this plan. She gets paid on time by this plan. That was also something very important to me. I knew that when my friends went to different people, sometimes it would take 6 months to a year before the practitioner was paid. I did not want to do that to my practitioners. And Uniform pays on time. This Uniform Classic pays on time and one of the highest payments to our practitioners and therefore our benefit. So it's my hope that this will be struck down. Thank you for your time.
And last We are staying the last comment to the resolution before us, so the board can make a motion to proceed with, that we can come to a vote.
Point of order. I'm concerned that with the way the meeting has been run today, if there really will be no ability for the 300 people who logged in to make public comment to make their comments. This has taken a very long time, and the chair has allowed people to speak, not to the resolution, but to speak in general about their concerns. I haven't had a chance to speak about my concerns about losing UMP, and neither have hundreds of other people. I'm concerned that someone working for the HCA or PEB, I think Dave, said that the public comment would be happening, I guess.
Going to start at 9. And it goes till 2 o'clock.
Please.
And I started late and I can't get in, I can't say anything.
That we can make, the only way that we can make public comment is from 1:30 to 2. We won't have a chance to make that comment. I think you need to understand that we're here to tell you why changing from UMP to a Medicare Advantage program isn't what we want. We need to have that opportunity.
Madam Chair?
When do we get a chance, and for how long will you stay here so that we can make a comment? We're going to end this meeting and people won't be able to speak.
So at this point, I'd like to close the public comment, and board members, I'd like to take us into action on this specific resolution. Then we're going to move into our regular agenda on all the other board business, and then we will move to public comment at the end. And we'll take further public comment on broader public decisions. So board members, Leanne has brought before us the resolution you see before you, PEB Resolution 2022-16. Resolved that the PEB board postpone action on closure of the UMP Classic Medicare plan until at least January 2024 to allow staff to interact in earnest with stakeholders. We have heard comments from the audience specific to the resolution. Now, are there any final comments from the board? And if not, I will move us into roll call vote.
Madam Chair?
Yes, John.
Hi, I have a comment. There seems to be a lot of concern about individuals going bankrupt or losing everything with other insurance products. I think we should make it clear that there's maximum out-of-pocket expenses and costs on almost all of the products. Am I clear? Am I right, Madam Chair?
No, don't do this, John. You're like the.
John, if you could hold that comment, we are in motion. If that's a form of a question about this resolution, then I'll let it proceed. But if not, I am staying focused on this resolution.
Okay, thank you.
And John, you're a non-voting board member, so I'd ask you to continue to listen in.
Sure, absolutely.
I believe, Tom, you were trying to speak up. And then I'll recognize Elliot next. We are again discussing any final comments from the board before we vote on Leanne's proposed resolution.
Chair Birch, I did not raise my hand.
Okay, thank you. Elliot, go ahead.
Yes, thank you. I will support this resolution with the understanding that the words "in earnest" mean that members of the public and affected individuals will have a chance to participate in the decision-making process as a stakeholder.
Thank you, Elliot. So I'm hearing your comment and believe it substantiates your second and moving forward. Is there any other comment from board members? All right, we're going to take a roll call vote. Harry Bossy?
I vote yes.
Thank you. Scott Nicholson?
I vote yes.
Elliot Weinstein?
Yes.
Monica McElmore?
Yes.
Tom McRobert?
Yes.
Leanne Kunze? Aye. And this is Sue Birch. Resolution, the PEB Resolution 2022-16 for postponement action on The closure of UMP Classic passes. So I'd like to move us now into the business of our board meeting. And so we are moving to the agenda item UMP RFR 2022 for benefit year 2023 and UMP benefit resolutions for action. Christine Davis, our UMP account manager with our ERB division, is bringing back 2 resolutions related to the Uniform Medical Plan CDHP offering for action, and then she will introduce a new resolution about UMP accumulators with action scheduled on it for the next board meeting. After Christine reviews the resolution for this action, I will read the resolution, and then I'm going to ask for a motion to adopt and a second. I'm going to invite public comments specific to this resolution, and this is for the CDHP plan. It's not Uniform Medical Classic. I'll ask for discussion from the board until we are ready for a vote. And after our votes, Christine will introduce a new proposed resolution. Her materials are behind tab 3, and for the general public, those are posted. Christine, please proceed.
Thank you, Chair Birch and members of the board. Yes, I am Christine Davis, and I will be presenting on Uniform Plan resolutions for benefit year 2023 for your action. Next slide, please. The 2 recommendations for your action that we will be reviewing are Resolution 2022-05, which indicates a proposal to increase the IRS minimum deductible amount for our consumer-directed health plan. The second resolution is 2022-06, which HCA proposes to allow certain prescription drugs to be covered pre-deductible per guidelines from IRS Notice 2019-45 for certain conditions. Next slide, please. As derived from IRS Revenue Procedure 2022-24, for benefit year 2023, HCA plans to increase the minimum deductible for single subscribers from $1,400 to $1,500. All other tiers will increase from $2,800 to $3,000. For additional context, Consumer-Directed Health Plan launched 2012, no increase since its inception. After a decade, it is necessary to increase the minimum in order to maintain an IRS qualifiable plan. Next slide, please. Bringing this resolution back to you, language unchanged from the PEB board presentation that took place on June 9th. A similar resolution passed with the sub-board. Since this was presented to the board on June 9th, HCA received generally supportive responses from stakeholders. Board members will receive a copy of emails we received, plus an Excel spreadsheet outlining those questions. Are there any comments or questions before I refer back to Chair Birch on this resolution?
Thank you. I am not seeing any hands raised from our board members. So at this point, I'd like to move forward with the vote on the resolution PEB 2022-05. This is the IRS, the Internal Revenue Service minimum deductible for the consumer-directed health plan. We call that the CDHP plan. Resolved that beginning January 1, 2023, the deductible in the Uniform Medical Plan Consumer Directed Health Plan, CDHP, will be increased to $1,500 for single subscribers and $3,000 for all other tiers. Is there a motion to adopt?
I'd like to make a motion.
I second.
I believe that was Scott and then Elliot for the second. Are there any comments from the audience specific to this resolution only? Dave, and as before, I'll ask you to help me with the queue for those that are wanting to comment on the CDHP plan.
I see 2 hands. They were raised before the motion was brought, so I defer to you.
So I see Larry's hand has come down. Linda Rutland, could you please tell us if you have a comment on this resolution before us?
Pass.
Thank you, Linda. And Larry, could I please get confirmation from you that your comments are not or are not related to this resolution?
I accept that this is a resolution that you'll be voting on, but I just want to please, Sue, really the disrespect that has been shown to the membership up to this point in time is ongoing and continuing under your control. If you don't let them speak within this 3-hour period, they have to wait, 200 people have to wait 3 hours in order to speak, is a continuation of that disrespect in terms of the input of your membership. Take this opportunity to do the right thing. Just, it's your chance to do the right thing and let people speak and get things off their mind now. I'm just asking you to do the right thing for your own, for the entire organization.
Larry, we need to keep focused on the business at hand. So I appreciate your comments. We will be getting to those as quickly as possible. So board members, I don't believe there are any other specific comments from the audience. And I would like to see if there are any comments from the board regarding this resolution.
There are comments from the audience.
About this resolution.
Yes. Voting on this resolution now, instead of allowing people to speak the way you said they would.
Oh my God.
Is going to turn away hundreds of people.
Excuse
and they're
me,
going to be angry.
John,
You're wrong to do this. Hundreds of people, because of your delay in the letting us speak, hundreds of retired people are not going to be able to speak today. 2 o'clock will come, and after they've waited all day to speak, you're going to say, time is up, go away. And that's after you tried to take away our insurance without notifying us.
Excuse me, I'm sorry. This is related to a different health plan within the portfolio of offerings. This is not related to UMP. This is for other members. We cover 700,000 people between PEB and SEB. So this is a different plan completely. Let us get through our business and then we will get to the public comments. So board members, are there any comments from you as board members about this particular resolution, 2022-05? We have to get back to our agenda process so we can move quickly to get to those public comments. This is going to be a roll call vote. Harry Bossy.
Aye.
Thank you, Harry. Scott Nicholson.
Yes.
Elliot Weinstein. Elliot Weinstein.
Yes, I was able to unmute. Yes.
Tom McRobert.
Yes.
Leanne Kunze.
Yes.
And this is Sue Birch. I vote in the affirmative. Resolution PEB 2022-05.
I also support.
Oh, I'm sorry. I thought, Monica, I heard a yes from you. I apologize. So we have unanimous approval of resolution PEB 2022-05. We will now move on to Christine, again, who will review the next resolution scheduled for a vote, and we'll continue to move quickly so we can get to those public comments. This vote is resolution PEB, or I'm sorry. This is the resolution PEB 2022-06. It is for the Uniform Medical Plan. Again, the CDHP Pharmacy Preventative Care. It has nothing to do with Uniform Medical Plan Classic, completely different plan. Resolved that beginning January 1, 2023, the UMP Consumer Directed Health Plan, CDHP, will cover the drug list presented to the board on June 9th, 2022, prior to the meeting the plan deductible. Thereafter, HCA may alter this drug list to allow for pre-deductible coverage based on clinical evaluation and in accordance with the IRS guidance. Is there a motion to adopt?
So moved.
Thank you, Tom.
I second.
Thank you, Elliot. Are there any comments from the audience specific to the resolution? Again, this is the CDHP Pharmacy Preventative Care, not related to Uniform Medical Classic. Larry, can you clarify if you want to comment about this particular resolution? Specific 2022-06. I'm not getting a response. So board, I'd ask, are there any comments from the board? All right, again, this will be a roll call vote. Harry Bossy?
Yes.
Thank you, Harry. Scott Nicholson?
Yes.
Thank you. Elliot Weinstein?
Yes.
Monica McLemore?
Yes.
Tom McRobert?
Yes.
Leanne Kunze?
Yes.
And this is Sue Birch. I vote affirmatively. Resolution PEB 2022-06 passes. Now we're going to have Christine continue with her presentation. This agenda is the Medicare portfolio comparisons.
So it's just Christine continues.
Oh, I'm sorry. So Christine, do you want to continue?
I do. So on screen is proposed resolution PEB 2022-14, known as UMP accumulators. Unit transfers. So proposed resolution PEB 2022-14 for UMP accumulator transfers between boards when a subscriber remains on a UMP plan. No action is required of the board today. A similar resolution was presented to the SEB board. This will require a vote in an upcoming subsequent meeting. Next slide, please. Currently, when a subscriber moves from one board to another, all their accumulators start over, which means they would start with a 0 applied toward their deductible and out-of-pocket limit when they start with the new board. UMP is recommending that certain accumulators follow the subscriber when they switch boards mid-year due to a special open enrollment, as long as they remain with a UMP plan beginning January 1st, 2023. The board voted last year, PEB 2021-16. All accumulators currently follow the subscriber when they switch UMP plans within the same board mid-year due to a special open enrollment. So this change would result in a more equitable experience for UMP subscribers who leave the PEB board and join the UMP plan under the SEB board. This resolution would result in accumulators for deductibles and out-of-pocket limits following the member, resulting in a lower cost share for the member. A similar resolution was presented to the SEB board earlier this month, and this change would need to be passed both boards to be implemented. Next slide, please. Here you can see UMP's recommendation that beginning January 1st, 2023, when a subscriber enrolled in a PEB program uniform medical plan changes their enrollment to a SEB program uniform medical plan during the plan year due to a special open enrollment, not including open enrollment, accumulated deductibles and out-of-pocket maximum expenses, both medical and pharmacy, will transfer with the subscriber. And that is the end of my presentation. Next questions?
Thank you, Christine. I'm not seeing any hands raised. Dave?
Yes, Chair Birch, I would like to recommend that we move Ellen's presentation to the next board meeting so that we can get to really the core business of passing the premiums to ensure that open enrollment can proceed this fall with plans available to our Medicare population, get that core business out of the way. Although Ellen's presentation has a significant amount of answers to questions that have been asked, I think it's important that we just move through the minimum business and open up public comment as much as possible. So Ellen, I'm sorry, you're being bumped. That means I think we're going to invite Sarah Whitley up next to bring the premium resolutions forward. And then we'll be able to move to public comment quicker. I hope you support that recommendation, Chair Birch.
Dave, I think that's a great idea. Thank you. So let's move quickly now to the agenda. Well, actually, Dave, one point of clarification. I think the portfolio comparisons are very important for all of these attendees at a future meeting. So those listening in, please make certain that you monitor, again, the board's activities, because there is some very compelling information about what's happening with the federal Medicare program and the portfolio comparisons. So we're going to move into this agenda item, 2023 Medicare rate resolutions. Sarah Whitley, who is our ERB Finance Unit Manager from the Financial Services Division, is here to present the information on some finance-related questions asked since our June 9th meeting on the Medicare offerings and to present several resolutions for board action. I do want to reiterate for members of the public who may not have joined us at the start of the meeting that there will not be that vote on resolution 2022-12. And after Sarah reviews the resolution for action, I'll read the resolution and then I'll ask for a motion to adopt and a second. And I'm going to invite public comments specific to the resolution. And then I'll ask for discussion from the board until we are ready for a vote. Sarah's materials are behind tab 5. Sarah?
And Sarah, I would recommend skipping the follow-up questions. We'll address them at a future meeting. If you just proceed with the resolutions necessary for the Medicare premiums, I think that would be best.
Absolutely. So if we could skip down to slide 9, that's where we begin the fully insured Medicare resolutions. For the record, my name is Sarah Whitley. So we'll now move into those fully insured Medicare plan resolutions, where I'll pass the microphone back to Chair Birch after introducing each resolution. But before I do, I want to remind the board that you'll be asked to adopt the resolution for the carrier, not the individual plan. And by adopting the premium, you're also adopting the benefit design underlying those premiums. So our next slide here, this is the resolution that would set the Medicare explicit subsidy at a cap that was set and funded by the legislature for plan year 2023, which is $183 or 50% of the premium, whichever is less. However, we do always remind the board that you have the authority to set a lower subsidy amount should you wish. Sue?
Okay, we're going to take the vote on resolution PEB 2022-07 on the Medicare premium. Resolved that the PEB board endorses the calendar year 2023 monthly Medicare explicit subsidy of $183 or 50% of the premium, whichever is less. Is there a motion to adopt?
So moved.
Second.
Thank you, Elliot, and Scott, thank you for your second. Are there any comments from the audience specific to this resolution? Dave and Connie, and Jessica, I'm not seeing any hands raised. Are there any comments from the board? All right, this will be a roll call vote. Harry Bossy?
Yes.
Scott Nicholson?
Yes.
Elliot Weinstein?
Yes.
Monica McLemore?
Yes.
Tom McRobert?
Yes.
Leanne Kunze?
Yes.
And I'm Sue Birch. This resolution, I vote in the affirmative. The resolution PEB 2022-07 passes. Sarah, let's move on to the next resolution.
Yes, this next resolution adopts the Kaiser Northwest Medicare plan premium listed on slide 2.
And the resolution is PEB 2022-08, Kaiser Northwest Medicare Premium. Resolved that the PEB board endorses the Kaiser Foundation Health Plan of Northwest Medicare Plan Premium. Is there a motion to adopt?
So moved.
Is there a second?
So second.
Thank you. So Elliot and Tom was our second. Are there any comments from the audience specific to this resolution? Dave, Connie, I'm not seeing any activity. Board members, are there any comments from you, the board? All right, we will move to a roll call vote. Harry Bossy?
Yes.
Scott Nicholson?
Yes.
Thank you, Scott. Elliot Weinstein?
Yes.
Monica McLemore?
Yes.
Tom McRobert?
Aye.
Leanne Kunze?
Aye.
And this is Sue Birch. I vote affirmatively. Resolution PEB 2022-08 passes. Sarah, next resolution.
Thank you, Chair Birch. This next resolution adopts the Kaiser Washington Medicare premium, also listed on slide 2.
Great.
Point of parliamentary inquiry.
I hear Craig Miller, I believe.
Yes.
The board is trying to do its business so we can get to public comment. And this is we have 2 more of our plan offerings that need to be adopted so that we can have insurance to provide to all of our members, the 350,000 that need to these choices of plans. Is your comment related to that, Craig?
Yes. Parliamentary inquiry.
Please state your inquiry.
You are voting on these issues and there's no tie, so you do not need to vote, Chairman.
Parliamentary procedure requires the chairman to vote only to make or break a tie.
Thank
But
you
our
for that.
parliamentarian, Mr. Michael Tunick, I believe our board bylaws give the chair the right to vote, but could you review the bylaws and provide insights on that?
Yeah,
I will. Yeah, my recollection on this particular point is just that that the chair, it's more of like advisory that the chair does not need to vote. When there's not a tie or when there's not a situation of breaking a tie, but that she can. But I will look at that. I really thought it was more of just a practice as opposed to a rule. And again, yes, so the bylaws would really control here, as you said, and also with smaller boards such as this, or I guess non-large governing bodies, the rules are a little bit relaxed as far as those. But I will look at that. So thank you. Please provide me a moment.
Thank you, Michael Tunick, our representative from the Attorney General's office, who has been with us now, I think, at least 4 years, as long as I've served as the chair. So we're going to move forward to keep going, and we're going to continue with what our established practice has been. Let's see, where were we? We are on, Sarah, you're going to present the next we're at 2022-09. So this resolution is that the PEB board endorses the Kaiser Foundation Health Plan of Washington Medicare Plan Premium. Is there a motion to adopt?
So moved.
Thank you. Elliot, second.
Second.
Thank you, Scott. Are there any comments from the audience specific to this resolution? Are there any comments from the board? Thank you. And again, we're going to proceed with a roll call vote. Harry Bossy?
Yes.
Scott Nicholson?
Yes.
Elliot Weinstein?
Yes.
Monica McLemore?
Yes.
Thank you. Tom McRobert? Tom McRobert? Leanne Kunze?
Aye.
Thank you, Tom. Leanne Kunze?
Yes, aye.
And this is Sue Birch. I'm voting affirmatively. Resolution PEB 2022-09 passes. Sarah, the next resolution, please.
Yes, thank you, Chair Birch. This resolution adopts the United Healthcare Medicare Plan premiums, also listed on slide 2. These premiums include the changes presented earlier this month related to a copay structure for prescription drugs and increases to the chiropractic and acupuncture visit limit to 24 visits, which is included in Ellen's presentation today in the public slides, at each applicable copay for each plan.
Chair Birch, I do want to say, because we moved Ellen's presentation, I think it's important if our administrative team can show the slide from Ellen's presentation that is intimately related to what Sarah just said. I believe it is slide 33 in Ellen's presentation, because this is a benefit change that was brought to the agency since June 9th. So could I have staff go to Ellen's presentation and show slide, I believe it is 33.
Thank you, Dave. I think that's a wise suggestion and will allow.
I'm double checking on my own. Yes, it is slide 33. So I'll walk through this slide briefly. Earlier this month, board member Tom McRobert asked that last year the Uniform Medical Plan had increased the chiropractic, acupuncture, and massage visits, and wondered if there was a possibility that the United Healthcare plans could similarly make adjustments. We approached United Healthcare about this really with an eye towards 2024, but United Healthcare came back and said that in fact they could make adjustments without making changes to any of the premiums that had been presented to the board on June 9th and are subject to the vote that Sarah is teeing up right now. So what I wanted to highlight here is that UHC can match the UMP Classic Medicare treatment limits, and on the PEB Complete plan would have a $0 copay, and on the PEB Balance plan would have a $15 copay. And what that really does is it's shown in the chart below. The current benefit in 2022 has chiropractic and acupuncture benefits combined with a 20 treatment limit for routine visits. And again, you see those copays existing today for complete are $0 for those combined 20 visits and $15 per visit for balance. And it would shift if the board adopts the resolution that Sarah is teeing up to what is on the right-hand side of this column, where there would be a separate treatment limit visit of 24 routine visits for chiropractic and a separate 24 for acupuncture, and retaining those copays that exist within the plans today. So a $0 copay within the complete plan and a $15 copay within balance. Again, because this was brought as a result of the board member question, and it does not impact the premiums in particular, moving from a customized bundled setting like we're in today to the standard book of business, it allows this to be absorbed within the premiums that are already shown to the board. So this is a last minute addition, but the agency feels when we're presented information, even if it's coming very close to the board meeting, it's our obligation to bring this to the board for your consideration. It is a benefit enhancement that doesn't come with cost. And so as Sarah has said, that adopting the resolution that's before you today on the United Healthcare premiums would include both the copay piece that was shipped in the prescription drug program that was identified earlier and shown at a prior meeting this month, as well as this chiropractic. I'm going to ask staff now to go back to the resolution in Sarah's presentation and hand it back to Chair Birch.
So I'm waiting for my resolution to come up on screen, but this vote is regarding the resolution PEB 2022-10, the United Healthcare Medicare Premium. Resolved that the PEB board endorses the United Healthcare Medicare Advantage Plus prescription drug MAPD plan premiums. Is there a motion to adopt?
So moved.
So move.
Is there a second?
Second.
That was Elliot and Scott, for the record. Are there any comments from the audience specific to this resolution?
This is Kimberly Chabot. I saw that I was pleased to see that 24 acupuncture and 24 chiropractic could be added and would be into the United Healthcare plan, but I don't see massage on that list. And currently the United Healthcare, or the Uniform Classic includes 24 massage. How will that be addressed?
Ms. Chabal, I can answer that. The current benefit in United Healthcare's plans is 30 massages with a $0 copay and complete and $15 copay within the balance plan. So there's no adjustment there needed because that benefit was already set by the board as a 30 treatment limit visit with those cost shares I've described when the plan was introduced in 2021.
Thank you so much.
Are there other comments from the audience specific to this resolution?
I have a question. My question is this: right now I have the uniform medical plan, and that's a supplement.
Excuse me, can you identify yourself?
I'm sorry, my name's Leanne Nielsen. I'm a retiree, and I have a question about the medical plan. Is the United Healthcare Complete, is that a Medicare supplement, or is that one of those deals where it takes the place of Medicare and the supplement? Does my question make sense?
Sarah?
Yes, yeah, Leanne, thank you for your question. The United plans are Medicare Advantage plans. Those are Medicare Part C plans.
Okay, so it's a supplement then, like the UMP is.
It is not a supplement plan. Yes, UMP is a Medicare Coordination of Benefits plan. The United plans are Medicare Part C, Medicare Advantage offerings.
Okay, that was my question. Thank you.
Absolutely.
Any other comments from audience specific to this resolution? Seeing none, are there any comments from the board? All right, we'll move into a roll call vote. Harry Bossy?
Yes.
Scott Nicholson?
Yes.
Elliot Weinstein?
Yes.
Monica McLemore?
Yes.
Tom McRobert?
Affirmative.
Thank you. Leanne Kunze?
Yes.
And this is Sue Birch. I vote affirmatively. The resolution PEB 2022-10 passes. Sarah, let's move on to our next one.
Yes, this next slide here brings us to our final fully insured Medicare plan premium resolution. And this resolution adopts the Premier Medicare supplement premiums listed on slide 2 in today's slide deck. Sue?
Great. So again, we're moving into a vote. This is Resolution PEB 2022-11. This is Primera Medicare Premium. Resolved that the PEB board endorses the Primera Medicare Supplement Plan premiums. Is there a motion to adopt?
So move.
Is there a second?
Second.
Thank you, Elliot and Scott. Are there any comments from the audience specific to this resolution? Seeing none, are there any comments from the board? Oh, excuse me, I see Sylvia's hand just went up. Sylvia, I'm going to back up to you if you'll take yourself off mute.
I didn't understand your answer to Leanne's question. The answer was that the United Healthcare is a Medicare Advantage program, but I don't think that answered the question she asked, which was, is it added to a regular Medicare or is it all private?
So thank you, Sylvia, for your question. And Medicare Advantage covers all of original Medicare. So it's you have your Medicare Part A and you have your Medicare Part B. And in UMP Classic, the plan coordinates payment of those claims with Medicare. In a Part C plan, it's very similar. However, there's no coordination of payment of those claims. The plan acts as your Medicare plan. So to answer Leanne's question, no, the UHC plans are not Medicare supplement plans. They are Medicare Advantage offerings. Does that help? Okay.
All right, we are back to Resolution PEB 2022-11. I'm not going to repeat, but this is specific, the Primera Medicare Premium. Board members, are there any comments from any of our board members? All right, this will be a roll call vote. Harry Bossy?
Yes.
Thank you. Harry Scott?
Yes.
Elliot?
Yes.
Monica?
Yes.
Tom?
Yes.
Leanne?
Yes.
And this is Sue, and I vote in the affirmative. Resolution PEB 2022-11 passes. We're now going to turn to the UMP Classic Medicare Premium. I believe Dave is going to introduce our last resolution for today. Dave?
Yes, I am going to, in the spirit of getting to public comment faster and the prior action taken by the board, codifying my original comments about how there's no intent of bringing resolution, a concept of closing the uniform medical plan today, tomorrow, July, this fall, or even 2022. I just want to move quickly. Slide 16 or slide 6. Move to slide 17. Slide 18. Slide 18. The only reason that this page is in the briefing book is for the board to be able to compare the language that isn't being asked for versus the language that is being asked for. So let's go to slide 19. The resolution that's being brought to you today related to the Uniform Medical Classic Medicare Plan is resolution 22-15. I do want to recognize that this is a little bit of a break in tradition because we do historically introduce a resolution at one meeting and ask for action at a subsequent. This instance, this is a subset of the prior resolution designed to help you just simply codify or pass that part of the resolution that without unnecessarily concerning folks that the other language might possibly be passed. And it is in line and mirrors the language of all of the other resolutions presented today. And it is important for HCA to be able to proceed with preparing for open enrollment. We have gone in recent years to ask the board to adopt the Medicare premiums in June so that we can begin preparing for open enrollment now. And so ask if there are any questions from the board before turning it over to the chair.
I do have a quick question. So 2022-16 is coming next, is it not?
2022-16 was voted on earlier today. That was the number. That was the number assigned to. It was assigned 16 because 15 had already been. The numbers had already been identified up to 15.
Okay.
So
thanks
there's no
for
additional
the clarification.
vote. Yeah, there's no additional vote needed on 16. It just was voted on at the beginning of the meeting.
Okay. Thank you.
Yep.
So Dave, again, I'm going to clarify with you for the entire board. This is the action that we take that allows the UMP Classic Medicare Premium to go into production and get us moving forward.
Yes.
Correct. Okay.
And without a premium vote, we have to have a premium vote in order to offer a plan.
Correct. All right. Board members, are there any other questions to Dave before I read the resolution? So I'm not seeing any hands. Resolution PEB 2022-15. This is Uniform Medical Plan Classic Medicare Premium. Resolved that the PEB board endorses the Uniform Medical Plan UMP Classic Medicare Plan Premium for the plan year 2023. Is there a motion to adopt?
So moved.
So move.
Thank you, Elliot. And is there a second?
Second.
Thank you, Leanne. Are there any comments from the audience specific to this resolution, which is adopting the 2023 Uniform Medical Plan Classic Medicare premiums? And I want to remind everyone, we're going to call for public comment about generally about the UMP Medicare Classic policy and the overall retiree plan offerings after this vote. But is there anything specific to this resolution that people would like to comment on? And I see Carol Dotlich's hand up. Carol?
Thank you, Madam Chair, members of the board. At the last meeting, I believe it was June 9th, I asked how the changes in the drug formulary saved money in the plan and how that savings impacted the current premiums. And I was told I would get an answer. So that's my question.
Thank you. Dave, do we have an answer to that question about the specific pharmacy piece?
I'm looking for Sarah or Tanya to chime in. Sarah?
Yeah, Dave, I believe that information was included in Ellen's slideshow. Luke had a handful of slides regarding the value formulary and some of that information. I'm not sure if it's appropriate to bring those slides up here.
I'm looking for a total. I don't need the detail. I just would like the sum total of what the savings were and how it impacted the premiums.
Carol, in the interest of time, I'm going to ask to research that, and I'm going to move to the next speaker so that we use our time so we can get to public comment. Is that acceptable to you?
Does that mean I'll get an answer today?
I'm hoping. Staff are searching through Ellen's slide deck, which is where we believe the information was. That was the agenda item we pulled off so we could move faster to public comment. But are you okay if I can move on to the next commentator?
Yes,
okay.
Yes, thank you.
Dave, who is next, please?
David Peeler.
Yeah, thank you. This is Dave Peeler. I wonder if staff could enumerate what that plan premium would be for 2023 compared to what it is for this year.
Thank you. Again, Dave, can we pull up that appropriate slide? Tanya, I think you or Sarah are best to answer this one.
So I'll ask staff to scroll back to slide. In this presentation, it is slide.
While Dave is looking, I just want to explain to the public comment, since we rearranged some of these things, we're having to go back and find the order of the slides. So we'll be right with you to get you that information.
Slide 2.
Thank you, Jessica. I know you are really doing an amazing job on the fly here. Here we go. And Jessica, can you enlarge that, please?
Further.
Oops.
So there we go. So these on the left are all the different offerings. And Tanya or Sarah, do you want to just quickly, Sarah, you want to take people through this real quickly?
Sure, I'm happy to review the slides here, and then I will ask for clarification on what exactly the question we're being asked to answer is. But this here is the single subscriber premium slide for the proposed 2023 Medicare rates. And we see here they're listed in alphabetical order. The UMP Classic Medicare rate is increasing by $73 this year. It's a 20% increase over last year's rate. Was there more that I should walk through on this slide?
No, Sarah, just for clarification though, so the board has taken action on the other plans within these offerings, and the specific motion that we're taking your comment on right now is around that blue line there that says UMP Classic Medicare.
Yes.
David, does that answer your question?
Yes, thank you. I was searching for that information in the staff materials, and I could not find it. So
there you go. Okay, I think Jose was next.
Mm-hmm.
Jose, if you could unmute yourself and provide comments specific to the board taking action on UMP Classic Medicare premium.
Yes, thank you. My question was related also to the premiums. So I would assume that if for 2 subscribers, we would just double the amount.
I'm getting some noise. Sarah, that's correct.
Jose, are you speaking to the single subscriber plus spouse premium?
UMP Classic Medicare, currently for 23, it's proposed, the amount is $438.34.
That is correct.
Yes, so my question would be if there's, a subscriber, 2 subscribers, we just double the amount.
So we actually include a slide. It's in the appendix of this slide deck. So it is, I don't have the slide itself in front of me. I believe it's slide 22. It is very simple math. You do multiply that $438.34 by 2, but you reduce it by $4.94 because we don't charge the self-pay admin of $4.94. They're listed in the footnotes on this slide. We don't charge that twice to an account that has 2 subscribers that are Medicare eligible.
Thank you very much.
You're very welcome.
I believe Annette Barca is next. And if I could ask those of you that have already had your questions answered, if you could put your hands down, just because we were trying to let everybody express themselves.
Yeah, yes, this is Annette Barca. I have been involved in the past with an employee trust for the school district I worked with. And one of the things I'm curious about, given the substantial raise with Medicare Classic, is what kind of things did you look at that might reduce the amount of increase in the UMP Classic plan that would make it more favorable to participants and not as expensive as it currently is?
Dave or Sarah, do you want to take that, or Tanya?
Dave, I'm happy to take this answer. So thank you for your question, Annette. UMP Classic Medicare, as the benefit design stands today, this is the rate that was developed for that plan. Now, as you mentioned, there are other options that we can look at, such as increasing cost shares for members, increasing deductibles, and increasing out-of-pocket costs. And those are things that we can follow up with during next year's board season.
Because the reason I'm asking is because I think there are some things that would be of minimal, that would be to make substantial changes and make it more favorable, and yet the impact of what you're doing might also, in the offset, save some money along the way. And part of it, I'm just really curious as to the what appears to be maintaining the status quo, when in fact it looks like you're really trying to kill the plan by making it so that it's more costly than it could be with making such minor changes, by maybe having no COB payment for the initial $250 deductible, maybe increasing the copay on the cheapest drugs from 5% to 10%, to maybe looking at a modified increase in the cap on drugs, to maybe look at some other kinds of modifications that would be minimal in cost to most participants, and yet it would be ones that could keep the overall cost of the program significantly less.
And Annette, I would just like to say that those are the types of things, some of them have been historically looked at, and those are the exact things that those ideas and those conversations for this, I'm trying to think of what the resolution 16 word was, but the engagement and these sessions and listening and working together to identify which things retirees may feel tolerable on those very types of benefit design changes for the reasons that you're raising. Where we are today, though, for 2023 is the benefit design that exists today produces these premiums that are associated with that benefit design. And we're really at a point when we talk about benefit design changes that we're talking about 2024 on benefit design changes. But those are the exact types of ideas that I'm hoping that we will all engage in as we work on trying to find and balance the interest of benefit design, affordability, and provider access for all of our plans, including the UMP Classic Medicare plan.
Dave, I just want to clarify that this has been the work of the board since the board decided to allow for the Medicare Part C offerings 2 years ago. So the staff have done an amazing job with the value-based formulary and really trying to drive more value. The problem is simply the federal government subsidizes these other types of plans, and they do not subsidize states' kind of classic products. That is the structural issue that we'll need the retirees' help on as we try to wage kind of a fight with our federal partners, saying it simply is unfair and it does not create a level playing field for these competitors.
Well, I am fully aware that everybody, I don't know what it is for your county, but my county, everybody who is in an MA plan gets, their plan gets $847 a month where they're being enrolled. And I think that turns out to be way more expensive than even the basic Medicare plans. So I think it's something that needs to be looked at. And I think it's something that is killing some of the good plans that happen to not be Advantage plans.
Thank you. Thank you, Annette, for those comments. And we certainly are very aware of this kind of national impact, and we're working with other states that are also facing the same challenges. And again, the board has been working on this kind of transformation effort around value and trying to get these components. Let's move on to Christine, because I still want to leave time for the public comment, and we definitely need to take action on UMP Classic Medicare so that we can have this offering. Christine? If you'll unmute yourself, thank you.
Yeah, this is Christine Clark. My husband and I are PERS 2 members. I'm the spouse of a retired public employee. We chose Uniform Medical Care Plan because we knew that our past medical conditions needed good care so that we could continue to contribute to our communities as retirees. My spouse, as a chemical engineer in 1970, was in a plant accident where he got chemical hepatitis from a machinery falling apart. At that time, there was no injured worker assistance anywhere. That was 1970. Myself, I have a congenital condition that wasn't apparent until I had a heart attack at age 75. And then I found out I have 2 rare heart conditions that put me in a class of less than 2% of the population in the United States. And what does the Heart Association tell us to do if we have chest pain? Go to the emergency room. I have become a frequent flyer until this year when I figured out myself to go off of a low salt diet and have a normal salt diet with whole protein.
I'm sorry.
Yeah. So thank you for your time, but that's why we are on Uniform Medical Plan. Thank you.
Christine, I'm going to take your comments as support for the board to pass the resolution before us. Is that correct?
Yes.
Thank you. Dave, is there anybody else in the queue for this particular resolution?
No,
All right.
Trevor.
Okay. So board members, are there any comments from you? If not, we're going to move to a roll call vote. Harry Bossy?
Yes.
Thank you. Scott Nicholson?
Yes.
Elliot Weinstein?
Yes.
Monica McElmore?
Yes.
Tom McRobert?
Yes.
Leanne Kunze?
Yes.
And this is Sue Birch voting affirmatively. This resolution PEB 2022-15, which is for Uniform Medical Plan Classic Medicare Premium to continue, passes. Now, I'd like to ask staff to provide me a list of all those that have signed up so that we can move into our public comment period. I know people have been waiting patiently. Dave, do we have an initial count of how many folks we have in the queue?
I believe that we are in the 45, 50-ish area. If you would like I did earlier, Chair Birch, I know I said that you would go through the list. I have the list and I can facilitate that if you'd like that.
Dave, that would be very helpful. I think if the board members would indulge me, I'd like to move to public comment because I know there's such interest. So in preparation for the public comment sections of today, you always can be emailing our board or contacting any one of us to provide any sorts of comments, either during public time or in between. We are always open, and Dave and I have all sorts of communications that come in. We need your name as we call on you, and so if you could identify yourself. And we are going to ask the public to limit their comments to about a minute. And I would encourage you to move quickly, and please try not to repeat the same themes, just so we can get the broadest breadth. This won't be the last time we take public comments. We take public comments every meeting, and it's an established process. So Dave, I'm going to ask you to cue us up and get us going. And yes, thank you again to everybody calling in for your patience as we got through the formal business to get all the offerings in place so that we've got products ready to go for next year.
And just to be clear, I'm starting with the list of individuals who emailed, the board emailed that we set up at the beginning of the meeting during executive session. And after that list is exhausted, then I will move over to individuals who have raised their hand currently. The first individual who, and I'll say the first name and then get the second person on deck so you can be preparing to unmute. The first individual is Larry, and then Sylvia would be second. So Larry, I know you've been waiting patiently.
Yes, thank you. Thank you. So, okay, I think we were told that we were gonna have more time than that. So I'm just gonna take what I got. Your HCA culture has been revealed. The reaction you see is a result of the loss of trust and confidence due to your treatment of your retired members. This abbreviated period of time to comment is yet another example of that. It speaks volumes about your truly unique combination of paternalism and disregard for the input of your membership. Director Birch, perhaps you don't know this, but when I wrote that you should communicate directly to the actual members, not the various associations that many do not belong to, I received this reply. HCA does not typically send direct communications to members on any policy proposal before PEB board takes action via official votes. Just to be sure you understand that, Director, that your policy has been not to tell the members until after the vote has been taken. You didn't even tell the elected representatives and senators, many of which have written to you about this implications for their constituencies. It's an epic failure in public relations and customer service. Please take and heed that as a signal for you to make improvements to your organization's culture. To add insult to injury, you didn't turn on the ADA required access for live transcript that Zoom has. City of Olympia uses it. All cities have used it that I've engaged with. I use it. It's available on a click. In fact, if you click on it now, you'll see that it says the host has disabled live transcription for the meeting. Another insult. You disabled it. The host disabled it. It's not a high technology thing. The fact that this is just now an issue for you also speaks volumes. Putting the interest of your membership first and respecting their input should be part of your mission and embedded deeply in your culture. And then you intended to push us off for 3 hours, but thank you, David Isminger, for helping her see that this is something that should be pushed forward quickly. I see now there are 45 fewer people now on board than there was at a 307 maximum before. You had people leave because of the delay, and that's an access issue. You know, access delayed is access denied. Okay, now to the policy itself. I have a wife, and her cancer that she has, we discovered 2 years ago, is extremely rare and uncurable at this time. Almost all the drugs and treatments are considered experimental and off-label. Only UMP offered the access to the best available and timely care in a medical area that is undergoing rapid change with new treatments. What I believe from past experience with managed care plans is that we had been part of that managed care plan, my wife would not be able to walk today or even be able to talk. We do not have the luxury of waiting for future life-saving treatments until UHC of medical gatekeepers and control cost algorithms have enough evidence for us to access it. We need guarantees. This is what I expect from from PEB and HCA to do. We need guarantees with real contract language, published drug formularies, and written approval processes that we would have received the drugs and care needed as quickly as under UMP and with the same access and expert care required for the stabilization and treatment. And we need that shared with the memberships directly, not through their associations with which many don't belong. We can't accept the PowerPoint platitudes that you put forth, the assurances that appear to be artfully worded by legal advisors to be non-binding, assurances that say similar coverage and benefits available in other plans. Yet when I asked your high-level staff directly over the phone about getting the same drugs and access to unhindered access to services, the answer was a long pause and no, they said, we can't assure that. Next point, prove your claim that cost control is not part of your motivation for this change by guaranteeing that any cost savings that results from eliminating UMP will result in lower premiums. When 4 of the 8 PEB members are listed as representing cost containment, we need an enforceable commitment. We're not asking for you to pay higher prices for this freedom for the state budget. We're asking for you let us to continue to pay the cost for as long as we can. So here's my summary of my points. Contract language, not PowerPoint fuzzy words like similar benefits. Real comparisons on drug formularies and access procedures for pre-authorization and approvals, as good as UMP. Any new negotiated plan must have the same formulary and procedures. Accept all current drugs that are being used and authorized by members today under UMP will not require a repeat of step therapy under new plans. And for those of you who don't know what step therapy is, it says that you must go through, get off your drugs, and then go through UHC's plan and prove to them that the cheapest drug is not satisfactory. And I can quote that definition from the Blue Cross Blue Shield website.
Thank you.
All savings go to the members, direct communications with membership, more transparency, and get your legislative team to go to DC and get Inslee's legislative team in DC to start working on to get a waiver for this drug disparity problem, which is causing it. Thank you.
Thank you for your comments and feedback. Dave, we're going to move on and I'm going to ask people to please 1 minute.
The next speaker again was Sylvia and then Michael Burton. So Sylvia.
Thank you so much. It's not your fault that our healthcare system in this country is broken, but it looks to me like you're helping promote its demise. According to the recent research I've read, Medicare Advantage Private had 75% of their inappropriate
Attention,
denials.
WSARA member FB Tools.
I beg your pardon?
Christine, please mute yourself. Go ahead, Sylvia. I think a member wasn't muted. Go ahead.
Well, I wanted to point out that Medicare Advantage private programs, and I'm not still clear what the difference is between what you're saying will get uniform or Medicare Advantage complete. But anyway, in the Medicare Advantage private programs, they've had 75% of their inappropriate denials overturned on appeal. So I don't know how they've talked to you that they're going to improve or they're going to not continue the policies that their United Healthcare companies done over all these years. Well, I'm sorry. I do want to have a mechanism where people like me have a way to communicate with all the rest of our members, because they only get your side and they never get the side of anybody else's opinion. I'd like you to work on getting that out to everybody.
Thank you. We appreciate that feedback and your communications. Dave, let's move on to our next commenter.
So we had Michael Burton, and then after him will be Maggie Lewis. So Michael.
Thank you, Dave, and thank you, Mike, and thank you, Sue and the board for your efforts. It's tough to do. I think I kind of just re-emphasized that I'm very much willing to pay for this program. I like the program. I can have the doctors I want. So many of the other ones, unfortunately, are not that way. So even though the rates are going up, and we'll do everything we possibly can to keep the rates down, I would really like to see that the uniform medical continue the way it is. And I also find it, Dave and Mike, I'm a former speech and debate coach at the high school level, and you had some interesting parliamentary questions today, which would have also been interesting at the national tournament. But thank you again. Let's keep this program. Thank you.
Thank you for your comments. Next, Dave.
That was Maggie Lewis, and then Laurie Widener.
Yes, this is Maggie. Three things. If there are PEB members who rely on their UMP Classic and are willing to pay for it, why can't the PEB board continue to offer it? As someone who in the last 2 years has been suffered from melanoma, breast cancer, broken bones, and all the diagnostics and treatments that go along with that, with no questions, no problems from UMP classes, never denying my care, I want this to continue. Two, it seems that if this change happens, I will now be forced to take an Advantage plan or an HMO plan. And then I went to Medicare.gov to read about what understanding Medicare Advantage plans. And it said, if you cancel a Medigap policy, you might not be able to get the same, or in some cases, any Medigap policy back. I'm afraid that if I am forced to change to an Advantage plan and then it does not serve my needs, there will be nothing else for me to do. I can't go back. And three, if the proposed change is passed, is PEB going to actively reach out to every single PEB retiree who has UMP Classic and walk them through the process of changing insurance plans to guarantee that all the forms are filled out correctly, submitted and approved, as well as helping the member perform all the changes needed to make sure that the new insurance is paid for seamlessly? What if these retirees are in the middle of stressful, life-threatening things?
Thank you for your comments.
Next is Lori, and then Shirley Hickey. Lori?
Thank you. My name is Lori Widener, and I'm the Executive Director of the Retired Public Employees Council. RPEC represents 11,000 state and public service retirees. 15% of our members subscribe to the UMP Classic Medicare program. I want to thank the board for reconsidering the UMP Classic Medicare resolution, and I especially thank board member Leanne Kunze for her motion to codify that no action will be taken on this plan given PEB's transparency issues. RPEC represents a significant percentage of the UMP Classic Medicare members, and we stand ready to work with PEB to co-construct a rigorous and transparent, authentic engagement process that includes listening sessions with retirees, survivors, active employees, and others in the PEB Medicare risk pool, as well as providers. Our state has a long history of elevating marginalized voices. However, this resolution to terminate this plan was crafted without any engagement. Effective policy improves the lives of our citizens, and effective policy begins with listening. Listening to our retirees must be an integral part of an authentic, transparent, two-way engagement process. We urge the board to make listening sessions with retirees the foundation of the path forward. In so doing, you will better understand the needs that our seniors have, and you will be better poised to use this information to inform policy decisions. Our retirees want choice. They want this plan retained. They want to choose from among traditional Medicare options. Our members are concerned about the state's move to expand for-profit privatized Medicare options. I want to thank you again for listening to our concerns and for restarting this process. We look forward to working with you on a transparent public process that will elevate the voices of our state retirees. Thank you.
Thank you for your comments.
Yes, thank you, Lori. We have Shirley and then Annette Barca.
Shirley Hickey, Vice President, Washington Education Association, retired. Chair Birch and PEB board members, I request on behalf of UMP Classic Medicare members and other future and current UMP Classic Medicare subscribers that you will actively work to discover findings from the UMP subscribers. provide comprehensive, non-privatized plan options, and support the ways in which all of us together may identify and implement true cost savings for providing medical services. I encourage you to use time from today through year 2023 and beyond to engage and work with UMP pre-Medicare and UMP Medicare subscribers to select options that include support for ease of selections, comparisons, choice of providers, comprehensive medical care, prescription drugs covered with very low, reasonably priced amounts to pay, copays, deductible, out of pocket. Medicare Advantage plans may charge lower premiums, but also send monies back to the insurance companies rather than sending the monies to provide medical services. In conclusion, shortened up here, the loss of UMP Classic would be an unfair, discriminatory act impacting those with a pre-existing human characteristic, getting older every year since birth. Let's steer away from ageism. Please strengthen choices for seniors. Thank you.
Thank you, Shirley.
All right, thank you. Next we have, again, Annette, and then Stephen or Elizabeth. I have, I think it's KDE. I apologize, and Annette, and then Stephen or Elizabeth.
Yes, I agree with what Shirley said. Could not have planned to be better with what she has. I think the biggest thing we need to look at is making sure that we are able to provide the type of benefits that people are wanting, and that we're looking at ways we can also contain costs at the same time without harming the participants. Thank you.
Thank you, Annette.
Then again, Stephen or Elizabeth, and after that, Stephanie Starkovich.
Dave, we'll move on and we'll get to the next person and we'll come back if you're trying to unmute.
I'll keep checking for Stephen / Elizabeth. Stephanie Starkovich, and then Greg Devereaux.
Hi, my name is Stephanie Starkovich, and I serve as the University of Washington's Director for Retiree Relations, and also as Executive Director of the UW Retirement Association. As such, I represent the interests of the UW's 10,000 living retirees and their spouses and partners. Since we shared the news of the proposal to discontinue the Uniform Medical Plan for Medicare-eligible retirees, we have been flooded with calls and emails expressing frustration with this proposal. The Uniform Medical Plan is the most popular healthcare option for the state's retirees by a wide margin. Retirees are not unaware of the increased premiums charged for this plan, nor have they failed to notice that the premiums for Uniform have been increasing over time. And yet, they continue to choose this plan for themselves and their spouses and partners because they believe it is the right plan for them. For many, cost is not the only nor even the most significant factor influencing a retiree's decision about healthcare, and it is both disingenuous and paternalistic to suggest that retirees cannot evaluate and weigh any number of complex factors in making this highly personal decision for themselves. On behalf of the University of Washington's retirees, I urge the Healthcare Authority and the PEB board in the strongest possible terms. Please reconsider and reject the proposal to eliminate this important option for the state's retirees. Thank you.
Thank you, Stephanie. And you know we have taken action today. Go ahead. Our next speaker, Dave.
Next is Greg Devereaux, and then John Borga.
Welcome back, Greg.
Thank you, Chair Birch, members of the board. I prepared lengthy and detailed comments, and I know that Dave wants to hear every word, but given your welcome earlier decision, I really appreciate that tremendously. In general, I think the action was too much too soon. I am an actual participant in the Medicare Uniform Medical Plan. So I really, again, reiterate, I appreciate your earlier decision, and I look forward to working with Dave and others in the future on how to fix the plan. Thank you.
Thank you, Greg.
All right, it'll be John Borga and then Mary Lindsay. John?
I'm John Borga. I'm a 70-year-old retired teacher. My wife is a 76-year-old school employee. We've been insured by UMP Classic and Medicare since I retired 8 years ago. We like our insurance. We are well aware that it's more expensive than other plans we could get, but it's worth it to us. We want to keep traditional Medicare, and we don't want to give it up for a Medicare Advantage plan owned by a for-profit corporation. We want access to a PPO plan, public PPO plan, like the Uniform Medical Plan. My wife and I don't want to be limited to an insurance company's network of providers, and especially at our age, we don't want to change doctors. Because we have had access to a wide variety of doctors for so long under UMP, our doctors are affiliated with different corporations. Our primary care provider, our otolaryngologist, my pulmonologist, our orthopedic surgeon, and my urologist are all affiliated with UW Medicine. Our neurologist and my cardiologist are affiliated with Swedish. Our gastroenterologist, our optometrist, and our eye surgeons are affiliated with private companies, all of them except UMP Classic. This is not a good time for anyone to switch providers. Many doctors are not accepting new Medicare patients. Many of the retirees you are considering kicking out of UMP Classic are in their 70s, 80s, and even 90s. It is cruel to make them search for new providers during this pandemic.
Thank you, John. I do want to provide the public just one update. I'm hearing that there are starting to be some bandwidth problems. And so if your camera is on and you're not speaking, I'd appreciate if you were able to turn it off and turn it back on when you're speaking. It's just we're starting to see some glitching in the system from that. And so if your camera is turned off or needs to be turned off, would just appreciate that to increase the experience that everyone's having. Thank you, John. Next is Mary Lindsay and then Tony Long.
And I want to just also thank you, John. And I really appreciate that people are narrowing their comments so that we can try to accommodate as many people. We're doing well on time, Dave. So we have quite a bit more time. We need about 5 minutes at the end just to refresh on some of the business processes. But thank you all for your patience.
Mary Lindsay and then Tony Long. Mary?
Hello, my name's Mary Lindsay, and I'm the WEA retired president, and I'm glad to speak with you today. I think you really did underestimate the passion of 54,000 people that are on the Uniform Medical Classic and Medicare Classic, and that we are your retired state workers and we're your retired educators, and we are knowledgeable piece of people. We know how to be we know how to organize, and we are going to stay with this. And I'm so glad to hear that you want to restart and do it the right way and have some respect for the people that are receiving this insurance. And I'm looking forward to working with other colleagues that are on this plan and also with the HCA workers too. And keep in mind that you too will be a retired public employee someday. So keep that in mind too. So thank you very much for your time.
Thank you for those comments.
Mary. We have Tony Long and then Carly Warren.
Okay, I tried to shorten mine quite a bit. My name is Tony Long. I've been a Washington State retiree since 2011 and with the UMP Classic Medicare plan since then. My concerns are threefold. One, your constituents have not been adequately educated about the reasons for or the impacts of this change. I contacted PEB several times, but never was able to speak to a person or receive an explanation. And this is over the last 6 months or longer for the larger increases I was trying to understand. But I was not complaining about the increases. Rather, I just wanted to understand them. And I've continued to struggle to get an answer to any of that with multiple tries. Number two, the disruption in the access to care and continuity care that will occur for this portion of Washington State's vulnerable seniors, the majority of whom have multiple complex healthcare conditions. This, in fact, is likely why they have chosen to pay a higher premium for the UMP Medicare plan, Classic plan. And number 3, elimination of the only traditional Medicare option, forcing all Washington state retirees to choose among for-profit private Medicare Advantage plans, regardless of whether our healthcare providers participate in these plans. Finally, I appreciate the resolution you passed today to delay this decision so you can better educate your constituents as to the reasons why this change is being considered by PEB and about the impacts of the change. We are rational people, but we do not appreciate nor understand when a popular choice is being removed, when we may be willing to pay the price to have it continue. So I look forward to further participation, further understanding on my part, and hopefully further understanding on PEB's part about what the issues are for all of us. Thank you.
Thank you. Thank you, Tony.
We have Carly Warren and then Sandy Lee.
My name is Carl Warren, and I'm in the southeast corner of this wonderful state. I happen to be a rural community and a border state community. In order for me to have care, I would have to go at least 3 to 6 hours anywhere to get medical care. Where I am currently, my providers are overjoyed to know that I have the Classic. There is no doubt that they will be paid. There is no doubt that I will receive the health care that is needed because of where I live and where I have to travel to. And in our golden years, we're supposed to be able to travel. This is the only plan that lets us go clear around the world and know that we will be reimbursed for whatever medical assistance has happened. So please continue this. I'm willing to pay the price. In fact, I've got 2 jobs extra as a retiree to make sure that I pay my premiums. But most of all, my providers need the reimbursement for the care that they're giving me and others in this age. So first of all, thank you for all that you're doing for us. Please listen carefully to everyone that has said, please keep this program. It makes a difference. And seniors do make changes, but we know what is best for us. Thank you, Carl Warren.
Thank you, Carl.
Yes, thank you. I apologize for mispronouncing your name.
I
have next Sandy Lee and then Claire, but I don't have a last name.
Yes, good morning, Madam Chair and board members. Actually, it's almost 1 o'clock. I do appreciate your earlier decision. In PEB, one of PEB's goals is to support employee wellness and retiree wellness. Considering a termination of the UMP Classic Medicare insurance just will create a cascade of failures to meet the wellness of those of our members. It takes away the continuity of maintaining the quality of healthcare by disrupting the relationship between patient-doctor and services that are vital to many of our senior members. It's clear in the literature that seniors' health improves when there is consistency in resources. When those resources and relationships are forcibly changed without any input, seniors' health care does decline, and that action places the burden then on the members to negotiate a whole new world with unfamiliar resources at an age when most are literally trying to maintain stability. By itself, this contributes to the decline in their health, thereby failing to meet the goal of supporting wellness. After the major challenges of the past 2 years, I would propose this change not be that we do nothing with this change at this time, and that it will cause nothing short of more trauma for our Medicare PEB members. I've been part of Kaiser and not UMP, but I can tell you that my care through Kaiser has been moderate to poor, and I have friends who have UMP who have had excellent care, and they're willing to pay the price, and we should continue to do that. Thank you.
Thank you for your comments.
Next we have, I believe, Claire Olivers, and then Judith Frey will be after him.
Hello, my name is Claire Olivers. I'm a member of the Retired Public Employees Council.
And I just, others have been more eloquent. I just have 2 points I want to reemphasize. With regard to the public process, having already tried secrecy and brute force unsuccessfully, I'm hoping that you will indeed have a true public process going forward that will listen and interact in a positive way with the affected parties. And then secondly, as pointed out by others, there's a great suspicion among many of our members about Medicare Advantage plans, and for good reasons, because we've all heard horror stories about the process of getting pre-approvals. So please try to find a robust, if you really believe what you have said about better plans at less cost, please try to find a robust supplemental plan with Original Medicare that you can throw into the mix of options, and recognize that keeping UMP, since you're keeping it for the regular employees, keeping it for the retirees and letting them decide when it's become too costly compared to the other options really makes a lot more sense in my mind. Thanks.
Thank you for your comments.
We have Judith Frey and then Patricia. I'm sorry, I don't have a last name, but Judith?
This is Judith Frey. I hope it will stay unmuted. I am president of a chapter of Retired Public Employees Council. I retired from higher education in 2000. I am now 77, and I also cover my husband, who is 83. I support the postponement of action so that you can gather information about what our real needs are. If it isn't self-evident by the number of people who continue to subscribe to this plan despite its cost. Each year in my family, we compare using the chart, the Uniform Medical Plan, to the other plans, and no private Medicare plan meets our needs given our previous existing conditions. In my household, and I won't go through symptoms or diagnoses, 19 prescribed pills are taken daily, and as well as 1 monthly injection. We are willing to pay more for Uniform Medical Plan Classic and hope it will continue to be an available option for retirees as long as we're able to pay for it. Thank you.
Thank you, Judith.
All right, we have Patricia. Again, I didn't have a last name, and then Linda Rutland. Looking for Patricia. Okay, I will put Patricia on another to call on again at the end in case. So we have Linda Rutledge and then JP.
This is Linda Rutland. I'm retired from Harborview Medical Center, which is part of University of Washington. And I have to say, in the beginning, when I first got the email back on June 14th, I was very upset. I was not even able to sleep that night. So please don't, I know that we've kind of postponed this now for another year, but it does look like to me anyway that it is probably going to get canceled. I really, really hope that doesn't happen. We worked very hard to obtain these benefits as a state worker. I really do feel like it feels it's discriminatory that if you're not Medicare, you can continue the plan, but if you're on Medicare, basically you're a retiree, and we're going to be taken off of the plan. For many of us, I have been on Uniform Medical since 1992. I've always been on this plan. It's very difficult trying to figure out all these other plans. I now live out of state. I'm not in the state of Washington anymore. I know with my medical plan that encompasses my dental, my vision, my prescriptions. I'm living in a smaller community. If I have to change doctors, it's very difficult. You can't get into most of these doctors' offices anymore. They don't take new patients. It's very difficult to navigate these systems. Most of us that are on this plan are aware that we're paying more money, and I'm willing to pay more money. I want to stay on this plan. It is the best plan for me. It meets my needs, and I don't want to have to go out there and try to navigate all these other plans that are out there. I do want to trust that you will do the right thing for us. But please keep this in mind, that it's very difficult as you get older to keep up with all these changes. Thank you.
Thank you, Linda, for your comments.
Joyce, this is Patricia. You have muted me and I couldn't hear you.
Perfect. We can go back to you, Patricia, and then we'll move to JP. Go ahead, Patricia. Thank you for jumping in.
Thank you. My name is Patricia Benavides. I am a retired public school teacher in Washington State. And first of all, I want to thank you for the opportunity to share some of my thoughts today. Number one, my last 6 years of teaching, I did not receive a salary increase, but I chose uniform plan because it gave me the opportunity to get the kind of healthcare services that I choose to have for my well-being, and that is integrative healthcare. The past 2 years, I was diagnosed with breast cancer. I have to say that because of this integrated approach, I was able to move through my journey with compassion because I had a medical team that worked together, and my plan allowed all of my providers to be reimbursed in a timely manner. That was critical for my recovering from the breast cancer as quickly as I did. This spring, I was diagnosed again with a reoccurrence of the cancer. And again, I was very grateful for the opportunity to have my integrated medical team working together to provide for my well-being. I am very strongly opposed that you stop this plan. It is not a plan that would benefit any of your 53,000 members, whether they're male, female, old, young, whatever. What I'm trying to say is the cost increase is minimal compared to having the opportunity to choose our providers, whether in-state or out-of-state, to choose providers that provide integrative and believe in integrative healthcare systems. I strongly urge you, and I can't say that strongly enough. I'm using the word strongly because that's how passionately I believe in this. I strongly urge you to continue to provide the plan for the members. And from what I'm hearing from other participants, people are willing to pay so that we can have the kind of care that we deserve. I've explored, since I got the message that you would, I have found that some of the providers that I would provide would not be eligible to provide my care because other plans would not be part of the network. And so I want to be able to continue having my providers. I want to be able to continue having the integrated and balanced healthcare that you folks provide. And I want to thank you for the opportunity to speak today.
Thank you so much.
We have JP and then Cheryl Nordmark. But JP, it may be that might actually be Jose Palmas.
Oh, thank you. Yes, board members and staff, thank you for your work. I know that you're working hard. You're doing the best that you can for us. But let me just, my wife and I are both retirees, and we have a lot of the characteristics that the prior members have voiced. Providers out of state, and but let me just tell you this. So a hitman gets his assignment. So he tells his target, because we've known each other since first grade, I'm going to let you choose between gun or poison. And because I'm godfather to your two oldest kids, I'm going to let you take care of the business yourself. Now, my wife and I feel like the target here. If at some point in the future, we're told UMP Classic is no longer an option. The options that you have are private healthcare plans. Thank you for listening.
Thank you, Jose.
Cheryl Nordmark, and then Aini Troop. So Cheryl? I can come back. I will check back. I'll put Cheryl on a recall list in case. Aini, I-N-Y, Troop.
Hi. Yeah, this is Aini. Hi. So thank you, first of all, for being here. And I know you guys have worked really hard on this, and I hope you're not being deflated by all the people that are so concerned, but appreciate the fact that we have some more time. Also, thanks to WEA retired President Mary Lindsay for all the communication that she's giving us through our emails. And so she's working hard too. I'm in Idaho. So some of my options are much different. There is no Kaiser at all. None of those options work. So my current insurance provider, not my doctor, but the insurance provider that works with UMC Advantage is Regents, which I'm guessing, that's what I can understand, if I were to switch from UMC to UHC, Regents might still be an option for me. I don't know how that works, because it won't be private then, right? It'll be, I mean, it won't be a classic Medicare thing. It'll be an Advantage thing. So I don't even know if I'll have Regents. It's pretty confusing. So again, that we have the extension is great. I do want to say that your opening this Zoom today has opened my eyes to a whole bunch of new things. So thank you for that, finally, and most of all, because I didn't realize that there was going to be such a huge shift from a Medicare Advantage to a Medicare what was it called? Supplement? Is that what it's called? The UHC? I didn't know there was going to be such a huge shift. So this is going to give me time to call all of my doctors and caregivers to see if they even would accept UHC if it is in fact going to be available in Idaho.
Aini, thank you for your comments, and we'll certainly, as we do our outreach efforts and whatnot, we'll certainly help you understand all the moving components and just getting as informed as possible. We really appreciate your comments.
Do you know that last question though? Do you know the answer to that? Is UHC actually in Idaho?
They are a national offering.
Okay. Okay, well, I have far to go. Thank you.
Next, we have Sarah Van Alstein, and then I have another Patricia with no last name. So I'll call for any other Patricias, but Sarah Van Alstein first. All right, I'll write Sarah on a list to double check, but any other Patricias? And after any other Patricias will be Dan Swenson, but any Patricias? This could have been the same, it could have been Patricia Benavides put on my list twice, so it's always possible. How about we move to Dan Swenson and then
I'm here.
Yep, go ahead, Dan.
Okay, I'm Dan Swenson. Thank you. I'm an RAPC member. I'm pleased that you made the necessary course adjustments today. And for purposes of brevity, I'm going to let Lori's comments on behalf of the RAPC fully reflect my views. She covered most of my points, as many of the other speakers have. today's mess really didn't need to happen. I hope the board has learned that to be of service to its members, there must be early and robust public involvement. Trust has been seriously broken between the board and the members. And I think it's going to take a lot of work to rebuild it. I think you need to develop a comprehensive work plan going forward with comprehensive public involvement that gets to these very difficult issues, and that we all have a chance to participate early on. So thank you, and I appreciate your time.
Thank you, Dan.
Next, I have Joanne Picken and then Lena Mulder.
Yes, this is Joanne Kicken. I'm a RPA PEC, retired at Rainier School for 30 years, new retiree. I am going to relate what happened to my family 35 years ago when we had only an HMO to go to.
I think I might.
My dad got injured. He injured his back, and we were 3 hours away from our HMO hospital in California. We had to drive him for 3 hours to get to the emergency room because otherwise he would not have had access to an emergency room. At the time, hospitals were turning people away. This is in the 1970s. They were turning away people, from the hospitals unless you had insurance. I believe that incident actually prolonged his recovery from his back injury. I am thankful that he did not have a heart attack when that happened to him 35 years ago. I am actually concerned about being in an out of network or out of a network area in the country without having access to health insurance. Uniform gives me that option to have some coverage. That happened to our family about 5 years ago when my son had to go to the emergency room in South Dakota. And because we had uniform, we were out of the provider network, but at least a lot of our costs were paid for. I don't want to be pushed into an HMO plan with a limited area of coverage. Thank you.
Thank you, Joanne, for your comments.
We have Lena Mulder and then Diane Rauschenberg.
My name's Linnea Mulder, and I'm a retired RN from UWMC. I've had classic UMP since 1975. I have one question and one comment. My question is PEB legally obligated to provide a Medicare supplemental option? The Premera G is a Medigap program, since you have to purchase the separate Plan D. So that I think is a Medigap versus a supplemental. So I have that question. And then my comment is about pre-authorizations. In the briefing book on tab 4, pages 12 and 13, there's a pharmacy and medical appeal data for United Healthcare. I think moving forward, as we're all going to be working together to figure this out, it's necessary to have information not only about number of appeals overturned for both Uniform and United, but the process. My experience from work is that the Medicare Advantage programs, you have a process that's multi-step. You have a denial, you have an appeal. You then in the appeal letter, you often then need to have documentation of 3 journal articles showing efficacy in the medication, and then it goes to a peer-to-peer review, and the peer-to-peer is very often not someone in the field of the person who's appealing. So and with Uniform, in my work experience, I never found that to be an issue. If something is denied, then the next step was actually just sitting down and talking to the provider. that multi-step PA process, which in my experience, Medicare Advantage plans have, leads to certainly delay of care and poorer health outcomes. Thank you for this opportunity for comment.
Linnea, thank you. And as we do our outreach, we'll get answers to your question. I know our Chief Medical Officer is listening in as well.
Okay.
We have Diane Rauschenberg and then Yona Mikowski. So Diane? I'll check back on Diane. Let's Yona. And then after Yona is Zona Spieth.
Hello.
Yes, we can hear you. Go ahead, proceed.
Okay. My name is Yona Mikowski. I'm a retired state employee, and I've been on the Uniform Medical Plan for over 25 years. My husband passed away last year, and he had been dealing with cancer diagnosis for several years. And being on the Uniform Medical Plan gave my family a lot of comfort and certainty that we were getting the care that we needed, and without all the bells and whistles that are required in some of the other plans. In your materials that were presented on June 9th, you referred to the Uniform Medical Plan as having limited value to retirees. And I would like to say that it has huge value to retirees, to be able to know that you can get the providers that you need, especially when you're going through the trauma of an illness. Thank you very much for delaying any actions. And I hope that you, in the future, be really upfront about like the differences between something like the Uniform Medical Plan and United Healthcare. I was a little bit concerned. It sure seemed to me like you were pushing that. A retiree friend of mine who just recently retired signed up for Uniform Healthcare, and she hates it. She's looking forward to switching to the UMP. When the price goes way, way up, perhaps many people will change. I don't know. Right now, it's worth the cost to me. Thank you.
Thank you, Yona, for your comments, and we're very sorry for your loss.
Next, we have Zona Spieth and then Susan Young. Zona? I will put Zona on the list to double check as we get towards the end. We have Susan Young and then Gina O. Susan?
Hi, thank you very much for giving me the opportunity to speak this afternoon. I'm a retired educator and was made aware of this opportunity by Washington Community Action Network. In 2004, my husband signed up for a Medicare Advantage plan because it seemed simple and convenient. Additionally, the literature for that particular plan promised that there was an alliance with Seattle Cancer Care, just in case that kind of treatment was ever needed. For 9 years, it was easy to be on that Advantage plan because he was in great health. But when he was diagnosed with cancer in 2013, we learned the hard way about the issues with Medicare Advantage plans. Although his cancer was diagnosed at stage 3B, it took months for him to get the referral appointments he needed. When he finally did get scans, biopsies, and other diagnostic testing done, the oncologist we met with recommended that he seek treatment through SCCA. We thought that with the referral and the promises that had been made on enrollment, that would be easy, but we were wrong. We met resistance at every step of the way. We had to fight to even get a second opinion at SCCA. And then when we learned that the top oncologist for this type of cancer was on staff there, we also had to work through a system of repeated denials and appeals to gain access to this physician. When surgery was recommended, my husband actually had to switch from the plan he had to another plan in order to be able to even have the surgery scheduled. Fortunately, it was at the right time of year to do that. I don't know what would have happened otherwise. Ultimately, the surgery did not take place due to other complications. I'm sorry, hold on just 1 minute. Hi, hold on just 1 minute, please. I'm reading some testimony. I'll be right with you. Ultimately, the surgery did not take place, but this was all happening at a time when he was his most vulnerable, thanks to the blockades we encountered with Medicare Advantage. We spent far too much time battling to get the care he'd been promised when he actually needed it. I'm now eligible for Medicare, and you can bet I went with a traditional plan and a supplemental. Medicare Advantage is a misnomer. In reality, it's actually Medicare Disadvantage. Thank you. Hi, is this the driver?
Oh, and Susan, can you, oh, thank you for muting. Next we have Gina O and then Elizabeth, also known as Elizabeth's iPhone on the as joined, but Gina O.
Hi, I'm Gina Owens. I'm a disabled woman on healthcare is a human rights steering committee. I'm on Medicaid and a Medicare Advantage plan of United Healthcare. I'm worried that Medicare Advantage plans are threatening the survival of traditional Medicare. Having a for-profit third party between me and my healthcare provider can be enough of a concern. But now I'm dealing with yet another for-profit third party, which has supposedly been contracted by United Healthcare to help manage my care. Their name is Benelink, and they have since made phone calls to me to strongly suggest that if I don't authorize them as another partner in my health decisions, I would be at risk of losing my health care. I felt like this was a direct threat. Call it a scam if you want, most people do, but the real issue is this. Why do our Advantage plans have that kind of power to contract with other quote unquote middlemen in the process in the first place? Shouldn't we be the ones to acknowledge when we need another partner in our care? And for your information, I'm just putting this out there because I really believe in the public process. And I really like that you are taking as many comments as you are today. I really think that's helpful. And I think it was really helpful that you made the decision to postpone your vote. And I hope that you will be diligent in getting not only public comments, but also bringing more whole stories of people who are actually impacted into your process before you do the vote in 2024. Thank you.
Thank you, Gina.
Next we have Elizabeth and then Christine Clark. Elizabeth? I believe this is Elizabeth's iPhone is the person who's trying to come off mute, maybe. I will come back to Elizabeth and ask for, oh, there we go. Go ahead, Elizabeth, we can hear you.
Okay. Hi. I have a question. When I went to work for the state and I'm PERS 2, I chose Uniform Medical Plan because it allowed me to coverage anywhere in the world to be reimbursed for it, and definitely any other state in the United States. I retired 11 years ago, and I have a disabled dependent daughter who is not covered by Medicare. We, at the request of her neurologist, I moved her to the San Francisco Bay Area. She is much better. She is using very little health care at the moment. She's in much better health, costing the state far less. And now it seems that to keep her here, I am giving up my coverage, that I would not have access to coverage in California without the Uniform Medical Plan. So, is this true?
Elizabeth, I think we'd need a little bit more specificity about the plan you're selecting and a little more information. Most of the options we have are national plans.
And
So
what does that mean? What does that mean, that they're good in any state? Any of these advantage plans are good in any state?
That there are providers in the networks that accept the plans in every state.
Okay.
That applies to the Primary, the United, and UMP. That is not the case for the Kaiser plans that are in the PEB portfolio.
Yes. Yeah. Oh, really? There is Kaiser in California. Nonetheless, as it's currently sounds to me, my daughter could remain, my disabled dependent daughter could remain in the uniform medical plan here in the San Francisco area, but I could not. Is that correct?
I think this is a great kind of question that will need to be focused on in our engagement. I'm worried about, I agree with Chair Birch that there might be some more specific information that can help us answer your specific question, but this is an example of a question that needs to be part of engagement about plan choices within the portfolio. So I do appreciate you flagging this as a very specific area of topics to make sure that there's engagement on.
Okay, thank you.
All right, thank you very much, Elizabeth. We have Christine Clark and then Pamela Woodrow.
Hello, this is Christine Clark, spouse of a PERS 2 retiree. Thank you for including me in this section of the meeting. I was with this concern about losing our uniform medical as a retiree. I was looking at the PEB website and I found out that some of the managed plan services don't apply to uniform classic retirees. For instance, the Smart Health Plan. That sounds like a good idea. However, as a retiree with uniform medical, we're not part of the Smart Health Plan. If we are healthier, if we have help getting healthier, we might be able to reduce the costs of our insurance claims. The same is the same thing for the diabetes plan. The diabetes prevention plan is available to UMP subscribers and spouses. I just found this when I was looking at the original Medicare plans for PEB's healthcare. We didn't know we were eligible for that diabetes plan. It was only for active employed PEB members. As I mentioned before, my spouse has severe diabetes from an employment injury before there was ever any injured worker plans. He has found his own internal medicine specialist endocrinologist with our change of plans. He uses uniform medical plan at Kaiser Permanente. He is accepted as a uniform retiree at Kaiser Permanente. His health team appreciates his professional engineer skills applied to his health care with the same concern that he had as a public employee of Washington State for ecology. I really would like to have that Smart Health Plan as part of our retiree health care. So I hope you'll consider that. Thank you.
Thank you, Christine. I just want to note that we have about 16 more folks and we have about 35 more minutes. And we want to try to get everybody in the queue. So let's move on, Dave, to the next person.
I have Pamela Woodruff and then Gary Federer. Pamela?
Hi, and I will be brief. I'm Pamela Woodruff. Can you hear me okay?
Yes.
I'm a PERS 2 retiree from Harborview Medical Center and the University of Washington, who retired 3 years ago. I appreciate the opportunity to speak today and appreciate your efforts to deal with these difficult issues. I agree with the first speaker and others that members such as myself have a right to have more say before the board votes on issues this important. And I'm glad you voted to expand the opportunity for members' input. I chose the UMP Medicare plan as the most comprehensive plan because of my own health vulnerabilities, as well as my observations as a 20-year medical social worker of the costs of inferior health coverage, which includes the Medicare Advantage plans. For example, I've seen clients and patients reducing their frequency of diabetes medications because they couldn't afford them, only to return months later to have their legs amputated. Another example is that reduced access to physical therapy benefits in the inferior medical plans results in acceleration to reduced mobility and increased dependence on skilled nursing facilities, which results in overall higher costs for healthcare. To do away with the UMP plan represents a breach of contract with 54,000 retired public servants. I strongly urge you to retain the UMP Medicare plan. Thanks so much for listening. Thanks for your time today.
Thank you, Pamela.
Next we have Gary and then Kimberly Olympia. And I know I heard your last name, but Kimberly, you'll be after Gary. Another call for Gary. Put his name on a callback list. Kimberly, and then we'll have Lois D.
Thank you. I appreciate all the speakers and the opportunity. I think one of the things that's become clear that we're telling you here is that we had very little notice. I actually was notified of this whole scenario unfolding that affected me tremendously by my next door neighbor app. Someone wrote it in there, and I'm so grateful for that. The other thing I was thinking about was that we're talking about, well, you know, can we look at other things? And you're not talking about eliminating the UMP. You're only talking about eliminating the seniors. Now, if you look at UMP and all of its members, let's just suppose that seniors only make up, let's say, 25% of the UMP plan holders. And you determine that you're going to just simply disallow seniors at this point, retirees. The cost of that plan, the UMP plan, will go up tremendously because the cost of the plan is based on the number of people participating and so on and so forth. That's part of it. So since the state has determined that the UMP plan is a viable plan, but not for retirees as being proposed, it means that you do support the plan. And the plan is great if you're in your 40s. But if you're in your 60s, 70s, 80s, 90s, as some of these people have testified they are and their family members are, it's beyond a hardship. I was recently retired and had very little notice. October 18th was the notice cutoff date. You're done. Because I had a medical condition. So my doctor wouldn't allow the vaccine. So I instantly became retired. I had no planning opportunity, nothing. And I can tell you that just the process of weeding through the plans and determining, okay, it was a whole education in itself, which when you get older, 70, 80, 90, you don't want to be fiddling around with this, with your health. You simply want to be able to go to your doctors, have them paid in a timely way. And the woman that pointed out that in your material, you indicated that the UMP plan wasn't really significant or whatever wording that was. I think what you've seen today here is that it is a very viable plan to those people who have preferences that they want to keep, that they've had for years and years, who have complex medical situations that only UMP pays for. And I just think it's time to go back to the drawing board on the whole shebang, because essentially all the seniors are being rounded up and sent forward on a train into somewhere, who knows where, possible plan, possible not plan, possible coverages, possible not coverages. I mean, I feel that this whole proposal was very ill-conceived. And I think that you're hearing that from people. So I want to especially support the process where you open up and you actually provide transparency by literally providing an opportunity for everybody to see the materials with enough in advance, 30 days, 60 days, 90 days, to review them and be able to participate in a meaningful way. Because every single speaker that I've heard here today is an educated person. They have personal knowledge of the system. And I'm wondering how many people on your PEB board or on the staff level that put this together are actually people that use uniform and have ever considered the impact that it might have not to have that option for you when you are a retiree. And I think we deserve better. So thank you for considering that.
Thank you for your comments, Kimberly.
Next, we have Lois and then Elizabeth K.
Hi, I'm Lois Danks from the RPEC chapter in Clallam County, chapter 23. And we have not received information on this until very recently, the last month, and we haven't had a meeting since then, but I've had calls from several members with concerns that this was just being pushed through without any information to the people using the healthcare plans and was not brought to us for any opinions or ideas or even information. And I think the main point was some of them say they're not on UMP, but they would consider it depending on what the contracts wound up looking like. I personally am on Plan F, and I'm hoping that it doesn't just disappear in the middle of the night. But what they're really concerned about is being forced into for-profit advantage plans. That this goes against the priorities, the top tier priorities of RPEC. Has one that is protect and expand Social Security, Medicare, and Medicaid. And forcing people into these advantage plans where the insurance company gets to decide your care and take a big cut off the top is not in any way expanding and supporting Medicare. It's actually detrimental and working towards doing away with Medicare. So that's an important thing to keep in mind, that a lot of the members do not want to see Medicare gradually eaten away by these for-profit insurance companies. Thank you.
Thank you, Lois.
Next, we have Elizabeth and then Amy White. Elizabeth? Elizabeth K.
Wonder if that was the same Elizabeth earlier, Dave.
Well, I will put the Elizabeth K on a recall list just to double check. Amy White and then Alan Burke.
Good afternoon. For the record, my name is Amy White. I'm in my 39th year of state service and also on the verge of retirement, speaking in opposition to the closure of the Uniform Medical Plan to Medicare retirees. I'm speaking not only for myself, but also for my spouse, who's retiring with 25 years of state service after 8 years of military service. We've spent nearly our entire careers as uniformed medical members after having spent 1 year in a managed care plan referral hell, which I spent fighting for care for my asthmatic child, my husband's serious medical condition, and my own autoimmune illness. I actually worked in Medicaid inpatient and outpatient hospital rate setting for years in the 1990s and the early 2000s. So I appreciate your work there, and I understand your challenges fairly well. But that experience also raises red flags about this proposal above and beyond its threat to my own family's health care. Operating the Uniform Medical Plan for active employees while banning retirees certainly has the appearance of cherry picking the younger and healthier into the plan, and also looks like age discrimination and patient dumping at its worst, as you consign the retirees, presumably older and sicker, to a bargain basement managed care plan run for profit by a Wall Street corporation that pays its CEO $12.5 million a year. You get what you pay for is a truism that is absolutely truest of all in health insurance. Please do not make the paternalistic decision that I can't or don't want to pay for my own medical freedom of choice and my own peace of mind regarding that freedom, telling me you've decided what's too expensive for me. I've spent nearly 40 years serving the citizens of this state and planning for my own retirement. Please don't rip this cornerstone of my retirement out from underneath me and my spouse. Thank you for the opportunity to comment today, and I implore you to do the right thing. Keep Uniform Medical open to Medicare retirees.
Thank you for your comments, Amy.
We have Alan Burke and then Sharon Etheridge. Alan?
This is Alan Burke, the Executive Director of the Washington State School Retiree Association. We have about 17,000 members, and you can imagine, Chair Birch, and the committee that we've had, I've had quite a few questions and comments the last 30 days, well, 20 days after this happened. I have 3 quick points. Number one is the decision to delay is the right one. There's no question that UMP is popular for a reason. 2 years into United Healthcare, we still have 15 times more people in Uniform Medical Classic than we do in the United Healthcare Complete, which is the one lined up to be pretty much the same as UMP. So we know people want that, and that's great. Number two, most of our members, as people have said today, are well aware of these things and can go ahead and figure them out. They have the ability to make a call and look at the information to do that. So there's no problem with that there. But I do want to mention the third point is there are, and this is one that I give credit for Dave Eisenminger and Sue and all of you that brought to our attention. And that is there's this pretty massive group of our retirees, and I'm dealing with them all the time, that have diminished capacity, nursing homes, have caretakers or whatever who just can't get the information, and they're not tech savvy, and they're going to go ahead and walk into a change and not know all the information. So I think one of the big challenges we're going to have here is the next several months and in the next several years, assuming uniform continues to rise, is that we're going to have a communication strategy to get out to these folks to make sure they understand. $3,500 a year will wipe out many of these people's pensions. If they want to make that call for, say, uniform, that's fine, but they need the information. They need somebody doing the analysis, and we really need to be able to reach out to that group and make sure they're aware of these particular things. I know that was part of the reason that the staff decision was to make, most of the reason staff decision was made to try to eliminate uniform. That's not going to happen now. Therefore, we need to switch back into the reality of let's get everybody the information we need and be able to make sure they have that to make a reasoned decision about what they ought to do with their health care. Thank you.
Thank you, Alan. We have Sharon Etheridge and then Joseph Batts.
Yes, this is Sharon Etheridge. Can you hear me?
Yes, go ahead.
Oh, I retired from WFC in Spokane, and my husband retired from the state employees in Spokane. We've always been so happy with our Uniform Medical. Appreciate that you guys are putting the decision off because it's really valuable to us, and it really caused a lot of angst that it may be going away. There was a thing brought up about retirees choosing to pay more out of pocket up front and not, more at the time of service. And I will tell you that what I've found that it's easier to budget knowing that's what I pay after our deductibles. I know that we have 12 ongoing prescriptions, and I know what those costs are. So the cost of the prescriptions under another plan would probably make up the difference of what the out-of-pocket savings would be. But it's just that it's so important to know. I consider it like budget billing for my utilities. Whether it's cold or hot, I pay the same amount a month. And there's times towards the end of the month, pickings are pretty slim in the checking account if we had big co-pays. And so our insurance man even tells us, don't move. We're pretty much uninsurable now. Our long-term health care went up 25% this year. and we had a choice to either pay more or lessen the benefits. We chose to pay more. The advantage of you folks letting us know a year ahead is when mine goes up next year for uniform medical, I already know it's going to increase by that $70. I can make adjustments in my budget or the decision to take chances with another insurance. And I appreciate that. So thank you again for the time and also for postponing.
Thank you, Sharon.
We have Joseph Batts and then Carol Dotledge. Joseph?
Hi, this is Michelle Griffin. I'm on my husband's computer, who's Joseph Batts.
Gotcha. Thank you.
Thank you. We live in a remote rural area of Central Oregon, and as members of UMP Classic, my husband and I can visit our separate primary care doctors at our in-network primary care clinic that is 10 miles away. If we are forced to move to United Healthcare Complete, we will have to travel 2 hours to reach an in-network primary care clinic, which has only physicians, assistants, but no medical doctors on staff. This would also require us to travel in snow and ice and other hazardous weather conditions in winter to get to a primary care clinic. Thank you for listening.
Thank you, Michelle.
We have Carol and then we have Matt Groshong. And Carol, we were planning after the end of public comment to come back and work on that question and answering that question that you were asking earlier. So I did want to alert you to that we're going to try to do that after public comments at the public comment. But go ahead, Carol.
I appreciate that. Thank you, Chair Birch and members of the PEB. I have a question and then a couple of comments. My question is, how thoroughly have you researched the appeals process? My concern comes from dealing with elderly people who do not appeal decisions because they just don't even get the process or that there even is one. And some of the appeals processes, you have to go through more than one appeal to get the answer that you want. And so I'm pretty alarmed about that. And I don't know how well you've researched the appeals processes of the offerings that you're making. So that was my first concern. My second concern is I'm planning to talk to my federal representatives about the fact that we're not getting the subsidies that the Medicare plans are getting. And I want to ask them to do something about it. But I'm wondering if the board is considering taking some action at the federal level to try to rectify or balance that outcome. And my third point is that I just want to say how grateful I am for all the people that came today and testified, because we have one rep, one voice on the board. And I think sometimes that voice isn't taken seriously, doesn't understand that that person is actually representing our 11,000 members when they speak. And I think the fact that you all showed up today lends greater credibility to our single voice on the Public Employees Benefits Board. So I want to thank everybody here, and I want to thank the board for taking extra time to hear the members speak. So I look forward to the answers to my questions and my concerns. And with that, I will hang up so others can speak. Thank you.
Thank you, Carol. We have Matt and then Bela. Matt?
Yes, my wife Kathleen is here too, and she has a comment after me. I hope that's okay. We're a team. Matt Rochon here. I'm a president of an RPEC chapter, and I have 3 quick comments. One, it appears that the Plan G Medigap plan is the least restrictive of the plans other than UMP Classic in terms of being able to choose your providers. And I think it would be really important for me when I and our members, when we make decisions on what plan to be in, exactly what the differences are between that Plan G plan along with this Plan D supplemental drug plan, that versus the offerings of UMP Classic. That's really important, I believe. Number two, an analysis of who wins and who loses, either financially or medically, if UMP Classic were eliminated. Who would benefit from that, and what profile of policyholder would lose if the plan was eliminated. And third, a particular gotcha, the big gotcha in the Medicare Advantage world is, it's my understanding that after 1 year on an Advantage plan, that you cannot leave the Advantage universe without being subject to underwriting. And in that underwriting, you can either have much higher premiums out of that process, or you can be denied completely. And I would like to see PEB explain prominently that in their materials. I'm really surprised how difficult it is to find information about that gotcha, not only from PEB materials, but also nationwide. Given the horror stories about Advantage, I think people should know that once you enter after a year, who knows what's going to happen, maybe something bad. Thanks to the board and Sue and Dave for this time. And now my wife.
Hi, my name is Kathleen Groshong. I am an RPEC member and a retired state employee. I hope my own clock is ticking here. Thank you for your decision today. I would like to speak about public engagement, the critical importance of public engagement, starting with planning right now. I mean, I know initially I thought, oh, well, that gives us time. But then when I was hearing about the 6 month prior in terms of your HCA decisions, it made me wonder. So will decisions need to be made by June of 2023 or June of 2024? That's not clear. I just know that a public engagement plan needs to be thoughtfully and carefully constructed in collaboration with RPEC and all of the other retiree associations. A lot of our seniors have massive technology as well as geographical divides that needs to be really taken into consideration. And I hope that a public engagement plan and timeline is in place, if not within a month, then certainly no later than 6 weeks, because the clock is ticking. I also just want to say, at a minimum, the communications plan, the communications just did not happen. We got no notification whatsoever from the healthcare authority that this was even being considered. We are longtime members of Uniform Medical. Kudos to RPEC for their communication. So that's it for me. Thank you so much for the opportunity to speak.
Thank you to both of you. Dave, I think we have 2 more speakers.
Yes, Vela and Craig. And I've had a lot of humility today in pronouncing names, and I appreciate the grace. You're on mute.
The first one ever mispronounced it, you know. It's Vala. Thank you. I was a state employee, retired now, of course, since 1990, and in Snohomish County. I believe that I've been on Uniform Medical since I started. And one thing that I think about is that I cannot survive on a supplement insurance. I can't do it. In 2018, I went into septic shock. I went into the hospital on January 22nd, and I did not come home until December 9th. So almost the entire year of 2018, I was in the ICU and going through amputations on all my limbs. And what happened while I was in the hospital was that Uniform Medical, or Regions, had and I can't remember what she was called, but a care team member who she worked for them, but she was working for me. So she was my contact person. And when we didn't understand things or we didn't agree with things, we could call her and she would go through the whole process with the insurance company and get things straightened out or get me answers. And we stayed in contact. She stayed in contact and followed me for another 6 months after I got out of the hospital. So that was something that was just priceless for us. And since an example of what prosthetics cost, I have, I don't know if you can see this, I have this beautiful hand, and this is $106,000. And my insurance covered it. And a supplement is not going to cover anything like that. And I have legs that have to get changed after so many years. They don't stay good forever. And Medicare is my primary. And of course, Regions is my secondary. Medicare doesn't cover those kinds of things as often as they need to. So it's very important to me that I'm able to keep my uniform medical as a secondary and not get into the supplemental stuff. And because I don't know what's going to happen, what's in my future, because I've never been an amputee before. And I don't know what's going to happen with prosthetic needs. And it's just too stressful. I was very stressed out when I heard that we were possibly getting rid of it for the retired people, which, as someone mentioned already, it's like age discrimination. If you're getting rid of it for us, it should get rid of for everybody, not just us. And you just shouldn't get rid of it. So I appreciate your time and listening. So that's all. Thank you.
Thank you, Vala.
Vala.
Craig, I believe you are our last speaker, and then we need to take care of a little bit of board business.
Thank you very much. I'm a retired teacher on Plan 1, retired since 2001. Worked 2 jobs since then, and I'm now working to pay for our insurance because we haven't gotten any increases basically since about 95. Our insurance has gone up. That ate away our increases that we got. I haven't seen a dentist. My wife and I have not seen dentists in 10 years. And our eye coverage, we both have glasses. We don't have vision coverage either. So everything goes up, but we're not getting any increases because I'm on Plan 1. We signed in for that. That's what they tell us from the legislators. And we don't earn a cost of living increase. So we've been stuck since about 95, not getting any increases because the insurance takes the rest of it. Thank you very much.
Thank you for your comments, Craig.
Chair Birch, I do want to do just one recall list through the people that I said I would recall, just in case they've appeared. I have Stephen and Elizabeth Coip, Cheryl Nordmark, Sharon Van Alstein, Diane Rauschenberg, Zona Spaeth, Gary Ferderer, and Elizabeth Kay. So just wanted to give one more chance for any of them to speak.
And could I just ask that we get staff ready to answer Carol's question, please, before we close the meeting?
Yes. I don't see any of those, but I do see Kimberly's hand again.
Yes, thank you. There was a point that another woman had made that I learned about not too terribly long ago as I was trying to figure out the plans and the Medicaid and or Medicare and supplements. And my person who was going to sell me a policy did tell me that it's a regular practice that the insurance, so we pay for the insurance, and the insurance companies go back and they get a refund somehow. So the monies that we've paid actually get refunded back to the organizations who are providing us services, not us. And so I didn't know if anyone else understood that, the point that she was making, but I thought it was important enough to repeat. Thank you for your time.
Thank you, Kimberly. We will certainly incorporate that into future outreach. I believe, Sarah, you're on deck to answer Carol's question. Is that correct? Or Dave, are you taking that?
Well, so we have Luke Dearden here, our clinical pharmacist. Part of Ellen's presentation, tab 4, that we push to next month, has 10 slides that relate in some way, shape, or form to this concept. And so I'm wanting to try to balance different. I was hoping we would be further away from 2 o'clock than we are right now, to try to balance some of those interests. And so those materials are set to be done on the July 14th meeting, but I also want to be respectful of Carol's question. So I defer to you, Chair Birch, as to how you want to proceed.
Carol, it's more than just one number. So it's with your permission, if we could defer either to a private conversation or to the next board meeting, that would be, I think, in the best interest for everybody.
We're absolutely happy to reach out, Carol, and have a private conversation in addition to the one that would be occurring on July 14th. Absolutely comfortable with that.
I think it's important that it be on your next agenda, and I would appreciate a private conversation, but I really think it should be a conversation that the board has publicly so other people can hear it.
Absolutely. It was in Ellen's presentation. So we are at the end of our board meeting. First off, I want you all to hear that we have heard you, and we thank you for your courage to bring your comments forward and to express them so eloquently. And we ask for you to stay involved. I want to thank each and every one of you for your comments and your time. I know it's been a very long meeting. I also want to thank the board members. It might not feel like it, but they work on these very issues every month throughout the year. And the staff that tee up this work. Healthcare transformation and the healthcare journey in this country is beyond complicated, and there are things we can disclose because of price bids and sheets. We are doing our best to be transparent. We clearly have heard some great suggestions today about stepping up our game with communications and outreach. So I want you to know that you have a commitment from me as the director of the Healthcare Authority and from Dave that we'll be doing more around communications and outreach. I also want to comment, though, about the federal involvement. We need your help. We have been bringing this up for years. And when we brought up the Medicare Part C plans 2 years ago, we were already talking to federal legislators to say, we have a problem that's coming. It's just that we were shocked to see the price variation this year. So I do want you all to please stay very involved. This group meets every month. Everything is publicly available. And I just want to commit to you that we really have people, as a nurse, this isn't just about the cost of your care. It's about the quality and certainly your experience. So Dave, I know we are having our next meeting, July 14th, 2022. It starts at 9 a.m. in the morning. We will be looking at the closed caption feature that apparently we have to buy that the state has not bought for these public.
At least our agency appears may not have bought, but we'll look into that piece. Yes, there's a different licensure
piece. And Dave, are there any final comments that you want to make before we adjourn? I'm giving you 1 minute.
Just that at the next board meeting, because it's always a preview of coming attractions. That's part of our tradition here is that we'll be presenting the non-Medicare plan premiums. That's for the employee population as well as the non-Medicare retirees. We'll be presenting those premiums for plans for 2023. And then also bringing back that resolution from several hours ago that Christine Davis brought forward on UMP accumulators. Otherwise, I just too also want to thank everyone, the board, my staff, and most importantly, the retirees who've joined us, some for the first time today, to share their insights. And again, this is the beginning of that conversation. It is not the end. And I'm glad that, I too am glad that Leanne proactively brought that resolution to provide reassurances. I I said many of the words that are embodied by that resolution. I know that codifying it, as Leanne said, was important, and so I'm happy that there's some more comfort and reassurances that this proposal has no timeline. So thank you.
And Dave, you are forgetting that the other agenda item that will come back is Ellen's Medicare portfolio comparisons. And it's very important for you all to dial in and better understand this federal and state kind of program. So with that, I am adjourning this meeting and thank you all once again. Meeting adjourned.